I'd like to welcome to the meeting the Minister for Health, Dr. Jennifer Carr-MacNeill. Minister Mary Butler will be joining us shortly. She's currently in the Dáil, I understand. We also have Minister Jennifer Marine O'Connor, who is the Minister for State Responsibility for Public Health, Wellbeing and the National Drug Strategy, and Minister Kieran O'Donnell, Minister of State Responsibility for Older People. Just a note that we received the Minister's opening statement late yesterday evening, so I think there may be hard copies available. And as we discussed previously, it is more beneficial to the committee if we receive documentation earlier. It just helps with our scrutiny and to be able to engage in it. So we would ask next time if we could potentially have documentation at an earlier stage. So to commence the proceedings this morning, I invite Minister MacNeill to make her opening remarks.
Thank you, Chair, and I confirm that what's in my statement reflects what's in the committee briefing that was provided prior to, a fair bit prior to that, so it's really a condensing of that. Thank you for the opportunity to discuss the revised estimates for vote 38 in 2026. As you're aware, the health allocation for 2026 is 27.35 billion. That's an increase of 1.3 billion in day-to-day spending, or 5.1% increase on the 2025 outturn, and it's 1.6 billion higher than the original 2025 allocation, so a 6.2% increase. Capital, including our digital investment, rises to 1.56 billion, an increase of 100 million, or 6.8%, and that's the largest ever annual investment in health infrastructure. We've quite a lot of work to do on that. Health now represents 23% of all public expenditure in the Irish state, excluding disability services. It's a very significant investment, and with it comes a clear expectation of results and value. The sustainability challenge in health is already becoming evident. In 2025, people aged over 65 years were 15.8% of the population, but over 50% of healthcare expenditure, and that's set to increase to 20.8% of the population by 2040. Of course, we regard that as a good thing, but it is also something that we need to plan for. In 2025, we achieved significant and measurable improvements in financial control. It really is a markedly different position than had been the case with the health budget in the past. The HSE delivered within the final current expenditure limit. Pay pressures were broadly contained within budget, and the supplementary estimate was sharply lower than in previous years at just 1.2% of the original budget. That compares to, say, 4.8 to 7.7% between 2022 and 2024. So it is a genuine step change in how resources are managed. The context for last year's supplementary is important, as we discussed at the time. As non-pay financial pressures emerged during the year, a mid-year agreement with the Department of Public Expenditure provided €300 million in additional funding. Despite significant demand pressures, though, the HSE remained within its revised expenditure limits at year end. And that outcome reflects a substantially strengthened financial controls, tighter in-year management and clearer lines of accountability across the system, though we need to go further on all of those things. Crucially, the rollout of the integrated financial management system now covers approximately 80% of the health budget. With IFMS, we will finally have one national financial and procurement system for health. That's going to give us faster, more detailed reporting and clearly show where overspending is happening. As well as stronger financial compliance and accountability, we will also be able to see the price being paid for the same goods and services across the health service, and that obviously allows us to have a better approach to procurement and identify further potential savings by treating it without any impact on patient care. We'll continue to roll out IFMS across the Section 38 voluntary hospitals at pace during 2026 to give full and complete coverage of financial information and visibility on how public money is spent in every place in health. As part of the Health Information Bill, which I discussed yesterday in the Shannon, we are giving the HSE clear legal authority to obtain standardised digital financial and activity data from all providers in the form specified by the HSE. The purpose of that is to help us plan and manage our financial resources. By setting out clear expectations on financial and activity data, the bill complements the rollout of IFMS, allowing the system to cooperate on standardised, reliable inputs across all providers. Of course, it has already been part of the service level agreement with Section 38 that this be done. The bill puts the issue absolutely beyond doubt. I did write to the Section 38 voluntary hospitals in January setting out the imperative to implement IFMS. In their responses, all of the hospitals have expressed support for the objectives of full financial transparency and the implementation of IFMS, and they are engaging actively with the HSE and department. Overall sentiment is one of strong support, constructive engagement and commitment to moving forward. On the ground, let me pay particular compliment to Tala and James's, who are moving further ahead and really seriously engaged with the implementation of this. I also would strongly encourage all of the voluntary hospitals to sign their service level agreements with the HSE so that budgets and staffing can be put into effect and move forward with clarity, accountability and focus on delivery in 2026. This year, the HSE, for the first time, has given service level agreements at the end of the preceding year. So it was given on the 15th of December 2025 for 2026. That is a marked improvement and a step change by the HSE, and I compliment them for that. But it is also a requirement that the service level agreements be signed and returned to the HSE within 4 weeks. To date, unfortunately, only 3 hospitals have signed: the Royal Victoria Eye and Ear, St John's in Limerick and Mercy in Cork. So we do expect hospitals, Section 38 hospitals in receipt of public funding, to sign their service level agreement with the HSE and to return that immediately. Ireland is experiencing significant growth in the demand for health services from a growing and ageing population. Very positive thing. A population of 5.5 million in 2026. That's 100,000 people above what the ESRI projections made in 2024 would be. The population aged over 65 is estimated to have grown to 15.8% in 2025 as compared with 15.1% in 2022. But despite rising demand, I have to say that 2025 saw an improvement in the daily average 8 a.m. trolley figures nationally. Admitted patients on trolley saw an average reduction of 30 per day, or 10% nationally. And that came even as ED presentations rose by 4%. But what I really need to speak to the committee about is the variable performance between the regions, between the 6 health regions, recorded in the reduction in their daily average trolley numbers. So, for example, Dublin and North East, where the Mater and Beaumont are, they had a reduction of 30%. Dublin and Midlands, 24% reduction. The Midwest, which is Limerick, down 20%. Dublin and the South East, including Vincent's, Waterford, Wexford, down 15%. The South West, which includes Cork, down 2%, while the West and North West actually had an increase. At site level, some hospitals faced much sharper rises in ED presentations, and particularly the Mater and James's, and nearly 10% in Limerick and Naas. But despite the pressures of increased demand, because of the way that we're reorganising the way the system works, we really have seen marked improvement in trolley numbers, in particular hospitals that have devoted themselves to it. Sites like Connolly Hospital in Blanchardstown down 72%, Navan down 60%, and both St James's and Tallaght, hospitals under huge pressure, exceptionally busy hospitals in well-populated areas, both down by a third. The focus shows that a real relentless day-to-day focus on hospital avoidance, appropriate hospital avoidance, patient flow, from the hospital front door to timely discharge, really delivers results that are patient safety results, reducing the number of patients on trolleys. We extended evening and weekend services through the implementation of the public-only consultant contract and 7-day rostering. We broadened diagnostic access and strengthened weekend discharge planning, but we are only at the beginning of this. We are really only 6 to 7 months into this, and we have a long way to go. You can see this in practical examples that I've listed for the committee. The Mater achieved a 30% reduction in 8 a.m. trolley numbers, supported by a real increased focus on weekend discharging, strong uptake of the public-only consultant contract. In St James, public-only consultant contracts are now ensuring that diagnostic, CT, urology diagnostics are happening over the weekend with increased weekend discharges. The core rostering of consultants and other staff on weekends in Vincent's, for example, has enabled a nearly 50% increase in weekend discharges and a 63% reduction in average trolley numbers, though they have some way to go yet in Vincent's. Despite a 7.5% increase in attendances in Connolly and Blanchardstown in 2025, admissions reduced by 2.5%, but the trolley count reduced by 72%. That is such a different experience for patients in the Blanchardstown region. It is so important that we continue to highlight the good progress and ensure that that progress is matched by other hospitals around the country. In relation to hospital avoidance, what we're trying to do is keep people out of hospital where we can. So, for example, we have frailty support teams. In Vincent's, we have hospitals like initiatives like emergency department in the home, where we're moving the emergency services out of the hospital to home. And that provides a 24-hour service since January, and it is having an impact. We've opened as well acute virtual wards to support alternatives to admissions and help get patients a care in the most appropriate settings. But it's not just about urgent and emergency care, although we have to get that right so that we can have better predictability. On planned care, we're also making progress. The surgical hub model in particular is extremely important. We opened our first surgical hub in Mount Carmel in February. We expected it to deliver 3,000 procedures procedures as it ramped up throughout the year. We actually got 3,700 procedures, and what that meant was a 74% reduction in people waiting over 12 months for certain lists within James's. We're also having more efficient rostering of staff and resources with significant increases in the number of outpatient appointments, and that is something that we are really going to drive hard with the rollout of the outpatient toolkit in 2026. So, for example, St Luke's and Kilkenny saw 5,700 more outpatient appointments. Tallaght saw 9,500 more outpatient appointments, and we have a long way to go with this. What we're trying to do in every way is through our outpatients, through our examination of the use of theatres, through our examination of the use of rooms in hospitals, we are trying to do more with what we have. One of the key, and I appreciate I'm out of time, so I might just make this point, Chair, one of the key pieces of analysis that we have is the baseline analysis for the outpatient toolkit. One example from the Southwest shows that the room vacancy rate in the hospital during the week is about 4 to 9%, but it's 24% on a Friday afternoon. We clearly have more capacity.
We're on the clock and you're already a minute over.
I appreciate that.
Thank you. You can, if you want another minute to conclude.
I appreciate I've given my statement to you in advance. These are just, I suppose what I want to say is we've had a very tight financial performance in 2025 that is different to what we've experienced before. We are driving hard. We do have an increase in budget, but we are really driving hard to do more with what we already have, with what the state has already invested. And while I'm proud to give examples of different hospitals, I recognise there are others that we need to bring all up together. And in particular, I would focus on the West and North West in relation to emergency care concerns that I have.
Thanks very much.
I'm in your hands.
Yeah, thanks very much, Minister, and thanks for the extended briefing document you provided last Friday as well. So thanks very much for that. We'll now move to questions from members following the rota, and I'll begin with Fianna Fáil and Deputy Daly.
And thank you, Minister, for coming here this morning, and to the urgency and the focus that you're bringing to your brief, and also to Minister Kieran O'Donnell, Minister Murnane O'Connor, and also to Minister Mary Butler, who has brought a lot of progress to the mental health area. But I do want to start where you had finished, Minister. You talked about West-North-West. North-West seems to be doing very poorly by a number of metrics, not just in trolley weights, not just in ER weights, but also in cancer care and also in the area of access to primary care therapies. When we ask parliamentary questions on these areas, we're finding that Northwest or West-Northwest is doing poorly compared to the rest of the country. Now, I just would like to ask you to make a comment around the cancer care in West-Northwest. We've had numerous complaints that women, for example, with breast cancer receive their diagnosis in a timely manner, but there's a significant interval between their diagnosis and their treatment starting. Could you make a comment on that, please?
Thank you. Yes, it's not acceptable, and what we want to achieve is that everybody gets their cancer treatment, their cancer diagnosis and treatment within the requisite period, particularly in those urgent symptomatic cases. And there has been a difficulty in relation to the West-Northwest in different ways. That is one of the reasons that we are making the regional funding model different this year, and that we are clearly tracking outcomes. So I expect the West-Northwest to devote themselves to making sure that there is a quality of treatment and quick access. That is as much to do with how the hospitals are run and managed as anything else.
But that's the question I want to ask. Yes. Is this about simply resources? Because I've been told, for example, that CAR-T therapy has been funded for Galway for cancer services and has not yet been delivered by HSE West-Northwest. So is this a management issue? Is this a resource issue? Because it appears to me Galway, Mayo, Roscommon, Sligo, the West is being left behind, and you talk about the inconsistency of service throughout the country. I want to know, can a focus be brought on the issues and the deficiencies in West-Northwest? So, for example, primary care, we have the longest waiting list for occupational therapy, the longest waiting list for speech therapy, the longest waiting list for physiotherapy, the longest wait for community ophthalmology. There's something really wrong.
There is something wrong, and you also have last weekend 1/3 of all of the hospital trolleys came from the West-Northwest, despite it not being one of 6 regions and having nothing like the population that would justify that, and there being a significant weather event on the east, not the west. So I agree with you, there is an issue. Can I say to you that tomorrow, Thursday, I am in Sligo with the managers of every single hospital from the West-Northwest, with the regional executive leadership team, and I will bring directly your concerns on all of these issues to them. My conversation conversation is specifically around what are you doing to roster people in the way that other regions have managed to roster? What are you doing to make sure that there's weekend discharging? Because the impact of urgent and emergency care impacts on everything else. If you're not getting that right, you're not getting the other things right either. If you're not rostering people for quick diagnostics to get people in and out of hospital, you're not doing it for cancer care either. And you're right, there has been significant additional investment in cancer services in Galway. Last year there was over 14 additional posts fully funded across surgical oncology, breast cancer, family history, radiotherapy, survivorship, CAR-T services. The acute haematology oncology service received additional advanced nurse practitioners. So there is this very significant investment. But how is it being organised? How is it being organised for the delivery of patients? And I have an issue with that, and I appreciate you raising it with me, because now I can take your commentary directly to that important meeting tomorrow with the West North West leadership.
Well, I appreciate your honesty around it, because I have it's embarrassing for the state and for the health service of women and their families phoning my office in Roscommon, Galway, asking for ways to get into the private system and pay cash to initiate their therapy for oncology after getting a diagnosis of breast cancer. And I would appreciate that you would bring a focus specifically on the interval between a breast cancer diagnosis and the delivery of treatment for those women, because by and large these are young women with families, and there's severe apprehension, anxiety around their issue. And also I would like you to bring a focus on why has the CAR-T therapy programme not progressed in West North West. I know it's in St James's Hospital in Dublin. I understand the funding was made available to start that programme there, but there is no sign of it starting.
But where is the urgency? You're right, it's due to open in Q1 of this year, and that has to happen, and I will do that. Again, you're absolutely right, GUH has faced challenges in meeting its performance targets for cancer services. That is not okay. The SACT services are due to be expanded with 6 additional chairs. As you know, I've also devoted 2 surgical hubs to the West North West region to ensure that there's additional surgical capacity. But one of the difficulties I have is we can put all of the resources and all of the additional theatre capacity in. If you don't manage it properly, if you don't run it properly, if you don't roster it properly, all of the additional capacity in the world isn't going to change outcomes. It's how people turn up. Let me just give you an example. Tipperary Hospital really hasn't had significant additional resources last year. It had an 88% reduction in its trolleys. There are more people being discharged from small hospitals at weekend than Galway University Hospital. Again, sorry to focus on that, but it speaks to the way in which resources are deployed. It speaks to the way in which things are being managed.
But you're right to focus on it, Minister, because the state is investing a huge amount of money in our health services, and we need to ensure that there is the proper return on that investment for the citizens of this state, and there should not be an inconsistency in access to service in a small country like ours. It shouldn't be beyond. I come back then to, and thank you for your answer in relation to that. We've seen the RT Investigates programme, and I've spoken to Minister Butler about this, and this is no reflection on anyone and the focus that's been brought on mental health service and the increased funding that has been brought to bear in that service. But there is no doubt in our rush to deinstitutionalise mental health care from a time where we were putting people with additional and special needs into mental health, into congregated mental health settings like our psychiatric hospitals, we have forgotten a group of citizens. They're the citizens who have enduring mental health issues, who have challenging behaviour that are a danger to themselves and to others. But there's another group of patients, our citizens, and they're the ones with enduring mental health issues who need supervision and care in the community setting, probably in a residential setting, because they simply cannot look after themselves. Now, I know in County Roscommon since 2016, 140 of these community beds were closed down. There were issues, and the CEO of the HSE said that, around some of those homes, but that wasn't a reason to close them down. Many of those of our citizens who are not able to look after themselves, the most vulnerable in our society, ended up in local authority housing and are going around the streets, for example, in Castlerea, where kindly supermarket owners feed them their breakfast because they cannot manage their own resources. And the promised wraparound services weren't there and aren't there for those patients. We have the Mental Health Commission coming to Roscommon University Hospital and publishing a report that shows that the psychiatric unit in Roscommon University Hospital is deteriorating from 2 years ago, and that they had to issue an immediate action notice, and because they didn't get adequate assurances, they had to have a regulatory compliance meeting. I'd like you to make a comment on that. I really feel very strongly, and we've had a lot of messages in on the issue of the RT investigates, and notwithstanding some of the inaccuracies that might be in it, there's no doubt there's a sense that we have criminalised mental health, enduring mental health issues for people who should be receiving their treatment in appropriate centres, either in secure units or in the community in residential care.
I might ask Mr. Butler to speak to that, please.
Thank you very much. Deputy, I have to push back on some of your commentary there because I think it's very, very unfair. Like, we came from a situation where we had people institutionalised in asylums, and we had to move back from that.
Minister,
please let me answer. You're after making several charges there that I can't
can I say this? I have no problem deinstitutionalising. My mother described in 1967 people with Down syndrome, unmarried mothers being put into St. Bridget's Hospital in Ballinasloe. I have no problem with that. But in the rush to deinstitutionalise, we have forgotten a cohort of patients. And that's a reality in my world, Minister. I don't want to have a row with you because I recognise your focus on mental health. I recognise the increased budgets. But I have to say, there is a reality on the ground in relation to this cohort of patients.
So I'm just going to speak to a couple of points that you made. So in relation to your saying there's a person there who's been fed by the local shop, there's not a community in Ireland that don't have people living in the community which endure mental health conditions. But I know, for example, out in Portlaw, where I have one of those people, that he has a social worker that visits. Not a community in Ireland that don't have people living in the community which endure mental health conditions. But I know, for example, out in Portlaw, where I have one of those people, that he has a social worker that visits every single day, that he has Meals on Wheels delivered to the house. And there's something happening here that person isn't referred on to having a social worker to protect them. And also being supported by the community mental health teams on the ground, because they're doing a phenomenal amount of work. We've 285 community teams across the country in relation to CAMS, in relation to general adult mental health, in relation to psychiatry and later life. 65 of those teams have been put in place since I took up office in 2020.
I accept that.
285 teams. We also have 1,200 people. We also have 1,200 people living in the communities, in houses all over the country with wraparound supports, and 500 people, no, it's very important, I'm sorry, just 2 seconds, 500 people with enduring mental health conditions have been rehoused in the last 18 months, working with the Department of Housing. So there are always going to be people that fall between the cracks, but if you know of somebody that's going to a shop being fed, the onus is on you to have them referred to a social worker so that they can get the correct wraparound supports.
Next lot is for Sinn Féin, Deputy Colman.
Minister, my review into a clinician in Children's Health Ireland is with the HSE and is with you. So we learned about this over the weekend, unfortunately, in a Sunday newspaper article, but also on radio today, and there was a briefing for Oireachtas members this morning, a clinical briefing. Can I just first of all get some information into the public domain, which I think is important? When did the HSE receive a copy of that Phase 1 report? I know there's 2 phases. This is the first phase that looks at the practice of a clinician. So when did the HSE receive that report?
My understanding is that the HSE received that report in September 2025 and were prevented from sharing that either with me or either the existence of it being with the HSE initially, and then the actually sharing it with me because of High Court proceedings.
Who prevented the HSE sharing that report with you?
The High Court process.
Did the High Court direct the HSE not to share the report with you?
Not being a party to that, I have to be very careful about what I would say in relation to that. What I know is that the HSE received it. I wasn't a party to those proceedings. Of course, the HSE were party to those proceedings. That the HSE received it in September 2025, and the first time that they were in a position to share that with me was last week.
Okay, but I suppose I want to understand, was it a direction from the court that that not be shared with you, or is that their interpretation of proceedings?
Obviously, Deputy, I'm not in a position to answer that, not being a party to the proceedings, and there are parts of proceedings that I shouldn't be party to because they're private legal proceedings.
So when did you receive the report?
I received it last week, and I received a clinical briefing from Mr. Nyagam on Friday.
Okay. So I learned over the weekend in a Sunday newspaper article, and I was contacted by a number of parents when they read the article, that you had that report last week. We know that letters were sent out to 91 parents of children who were part of that review, 62 of whom may need or will need clinical follow-up. Some may not, 19 may not, but all were notified that you now have the report. Why were they not notified earlier? Because it always seems to be, Minister, that the parents are always the last to know. And that is really hurtful for them. The last to know again, not for the first time, but again, the last to know that you received a report which may, at this stage, may not even be published. We don't know what its recommendations or findings are. They're not being informed of that, as I understand it, in the letter. But they, again, have to find out that you have that report from the media. I find that scandalous, Minister, so I'm just asking you why they were not informed earlier and why only yesterday were letters sent out.
So I agree, nothing like that should appear in the media, and I will be taking steps to try to identify how that may have happened. I was briefed on this by the clinician on Friday afternoon. There was a meeting to prepare for the letters being sent. That was Friday. The letters were sent last night, Tuesday night. So that is as tight a time frame, I think, as we could reasonably achieve. What we wanted to do is make sure that the clinician recommends ongoing follow-up in respect of some of the children. Some of the children, a very small number of the children whom he identified as needing more urgent follow-up, had already been contacted in the past and have already received follow-up where that was particularly pressing from the clinician's perspective.
No, I understand that.
The other children, however, is the ones you're referring to correctly. And so on Friday afternoon, there was a briefing with certain clinicians in order to prepare for this week. So, for example,
I understand that we've been briefed on that. I accept that, but I just want to come back to this point. It happened. It's a fact that it was in a Sunday newspaper article. It is not good enough.
I agree.
We've been here before. And the problem isn't so much that it was in a Sunday newspaper article. The problem is that the parents again find out through the media. In fact, we as politicians knew even before the parents. I would suspect that some parents may not have even opened the letters because they only received them today. Some of them will be working. They'll go home, they'll receive the letter, they turn on Morning Ireland, they hear about it, they read a Sunday newspaper article, they hear about it. It'll be broadcast, I'm sure, again today. It's unacceptable.
I agree with you, and in the 20 years that I've been in this building, I am not one to be giving things to media. I don't behave that way, neither do my team. And I find it appalling that people give anything to media in advance of it being appropriately and procedurally dealt with, particularly when the timeline is so tight. Well, I was briefed on this on Friday afternoon. Letters were sent to parents of the children on Tuesday evening for this morning. Obviously, we want to make sure that that's done correctly, that all of, at the most basic respect, that all of the names, addresses, everything is correct, and that we have clinicians who are there to follow up on those children, that those clinicians have been identified, that those clinicians are aware. I mean, could you imagine a parent receiving a letter saying your clinician is going to be X and the clinician not being aware that they are going to...
The HSE had this, Minister. Sorry, Minister. The HSE had the report in September. So why were the parents not written to in September, even to be informed that the HSE had it, despite legal issues?
The HSE will have to answer that within the context...
But you're the Minister.
But the HSE, to be fair, the HSE were not able, because of very significant legal proceedings, to share that information with me, and have been constrained in their management of this because of different legal proceedings. And I have to be very careful as Minister that I don't say anything that makes it even more difficult to take the next steps that we wish to take. Our concern, our priority is obviously those children. All of those children who required more urgent follow-up were followed up at an earlier stage, as identified by the reviewer, by the clinician, Mr. Nyagam, and those other children who we want to have an ongoing follow-up with were written to last night, and they will be followed up. There is an Assistant Director of Nursing in CHI ready to take calls from parents who receive letters. There are clinicians identified to provide that follow-up care. That did take us 2 or 3 days to put in place, from Friday afternoon when I received the briefing until Tuesday evening where the letters were sent.
I have to come in, Minister, because I have very limited time.
Of course.
from my perspective, and I just want to repeat this again because the Minister has given her view, from my perspective, it is unacceptable that the HSE receives the report in September. The Minister received it last week. There's a Sunday newspaper article, then there's a Morning Ireland piece, and only today parents receive letters. And it's a pattern that I've seen right through this process, and it really alarms me. And I want to come, Minister,
yes, Deputy, it's a pattern that alarms me too.
I want to come to the review that you commissioned as well, or are going to commission, because I spoke to the advocate groups last night and this morning as well in relation to that. What was committed to there was that an independent mediator would be appointed within 12 weeks. 13 weeks has passed, and there is no independent mediator established. And what the advocate groups have said to me is that they fear there is now a backtracking from you and from the Taoiseach in relation to what was agreed at that meeting, that they don't believe that they are equal partners in this process. So I want to give you an opportunity to respond to that, because I accept that the HSE has a role, you have a role, obviously, in relation to this review, but the people who have to be front and centre are the parents and the advocates. And they are saying to me that what was agreed from their perspective at a meeting with you and the Taoiseach, from their perspective, they see a backtracking. As I said, the mediator is still not appointed. Why is that the case? Why is there no urgency being brought to this?
A mediator was identified some time ago. We both agreed that we wanted both somebody of sufficient stature to do this work, but also available, which is not always the same thing. People of sufficient stature are not immediately available. We have identified a mediator who I believe is of sufficient stature to be able to carry out this work, and they will have a 16-week period within which to do it, having been appointed. We have agreed terms with that person, and that business cases with the Department of Public Expenditure and Reform. I would have informed the advocates, many advocates right across, those including those in the task force, those other advocates whom I would have had a meeting with the Taoiseach, as you referred to, of the proposed name, who's somebody of very serious stature, and we would very much like to make that appointment as soon as may be.
Well, I would just say in conclusion on this issue, Chair, that I spoke to parents, I spoke to advocate groups over the last 24 hours. In fact, I spoke to some of them on Sunday when they read the Sunday newspaper article, and they are really upset. You know, Minister, the trust is on the floor. Trust is on the floor, because this review that will now, we assume, won't be published. Am I right in saying that report, the first volume of it, the first phase of it, is not going to be published?
I would like the report to be published. And
I know you would like it to be published, but will the report be published?
I can't answer that yet, Deputy, because I have to examine all of the legal options that may be open to me in relation to that.
So we're here today.
So, Deputy, but I do need to answer your question.
No, but I just want to finish my point. My point is, we're here today talking about a report which is in your possession, in the possession of the HSE. A letter has been sent to parents which will not go into any of the findings, any of the conclusions. We don't know when the report will be published. In fact, it may well be it won't be published until the second phase is done. I find that unacceptable.
So the original.
I cannot ask. My question is this. My question is this to you, Minister.
Deputy, if we want answers to the questions we pose, we have to allow time for the Minister to answer them.
And I will. And I gave the Minister a lot of time. My question is: have you been directed not to publish the report? Is there any legal direction that's been given to you not to publish this report?
There is a legal agreement. I have to be very careful here, Deputy. Phase 1 and Phase 2 were always to be published together. I cannot comment on that as Minister, because these are proceedings to which I was not a party. The HSE was a party to High Court proceedings. It is necessary that I refer this in the first instance to the HSE until I can explore what options may be available to me as Minister. In respect of the inquiry which you have asked me about, we are absolutely committed to moving ahead with this facilitated process. I have identified somebody for some time, and we would like to move ahead with that to the next stage. In relation to hearing media reports used in media, I find that absolutely appalling that people would go. I also note that there was briefing to Morning Ireland this morning which did not come from my office in respect of both the letter to this committee in relation to BAM and in relation to the briefing that was being provided. I can assure deputies and everybody else that did not come from my office, nor did anything come from me to the media in respect of this report.
Thanks very much, Minister. Next we have Fine Gael.
So I wonder who it did.
Deputy Burke.
Deputy Burke.
Thank you very much. Minister, can I just refer to a paragraph, and I know you didn't go through it in your statement, and it relates to key performance indicators in relation to cancer services, and you referred to Cork University Hospital only had a 69% compliance with the 15-day rule. Now, I think it's important to highlight that in Cork, for well over 12 months, there was a 30% shortage of radiation therapists. There were 11 people appointed in November, 11 new radiation therapists over the last 2 to 3 months. And I understand that Cork University Hospital now is in full compliance with the 15-day rule. So I think it's important that when we are looking at where there are glitches in the system, we should look at all of the issues. And the issue here, Cork University Hospital were looking for these appointments for quite a long period of time. As well as 11 additional radiation therapists, there were also oncologists appointed. And I think it's important that we give credit to the hospital and to the staff for the work that they're doing. There was a 40% shortage of radiation therapists. And I'm just wondering, looking at other hospitals where there are delays, looking at all of the issues as to why those delays are occurring. And I think it's important to highlight that issue. Just in relation to in relation to cancer care and making sure that we can continue to deliver a fast response and provide the care that's required, we will have increased numbers because we have an increased population. Therefore, do we know, and what is in the programme for 2026 as regards looking at all of the cancer, the 8 cancer care units around the country, as regards looking at adequate staffing levels? And has that been looked at, and in particular, has been looked at from the point of view of over the next 3 to 4 years?
Okay, first in relation to Cork and radiologists, I'm sorry, I just lost my train of thought there. Excuse me, radiologists in Cork for cancer diagnosis. It is the responsibility to hire those. It is challenging to get radiologists and radiographers, but they also need to be rostered in a way that's going to maximise activity.
Minister, I'll operate for 12 months
yes,
to get
and
the
if you're satisfied, Deputy, as the representative for Cork with the standard in Cork, then that's fine and I'll take that back. I want to make sure that everywhere is operating to the highest standard and that all hospitals are using their diagnostic activity as best they can to meet patient need. Limerick, for example, has very significantly increased its diagnostic activity, and I would love to see the same happen in the southwest to meet people's needs. You're right, you have to look at every aspect of a hospital's performance, the resources that they have. I have to say, in particular in Cork, they do extremely well on making sure that they're not reliant on agency and that they have whole-time equivalents being recruited. That is going extremely well. They could do significantly better on their room utilisation route. They could do significantly better on their diagnostics. They could do significantly better on their consistency.
In relation to forward planning, because of the increased demand, are we looking at forward planning in relation to recruitment of, in this case, in Cork, there was a 35% shortfall in the number of radiation therapists. As a result, the volume of patients being looked after wasn't possible to do it. Now it is possible to do it because we've appointed them, and we're just looking at into the future over the next 12 months, 2 years, what plans are within the department as regards looking at that issue?
So we look at sort of the uplift that we get overall, and obviously we are aware we have 3,300 additional staff across the system on every piece. Each region has different challenges. We've just heard about the particular cancer challenges in the West Northwest as compared with the Southwest. So each has to look at their own particular need, and it may be that the allocation in this West Southwest needs to be on mental health, or it needs to be within their allocation of what's necessary. Okay. More broadly, we continue to put money into the cancer care programme itself. With the cancer care programme, I always think is slightly overstated in terms of the overall care for cancer. Money that we're putting into oncology drugs is care for cancer. Money that we're putting into equipment replacement programmes is care for cancer. The additional staff uplift is care for cancer. And you're absolutely right, we are going to have more and more cancer diagnoses. Again, because of a growing ageing population, as you have highlighted, that is a good thing, and we know that people are living with cancer so much better than before. But we have to look at cancer as one of the many diseases that each region needs to treat, and one of the many things it needs to support its people with.
Can I move on to a totally different issue, and that's in relation to immunisation? In the budget for 2025, it was, I think, the figure is increasing in 2026 from 10 million to over 50 million. is there a new, is it planned to have a number of new immunisation programmes in place in 2026? Because there's additional funding being provided. So I'm just wondering, where's that figure? How is that figure increasing so substantially? It's on page. I'm just reading from the estimates, the health budget estimates, and the increase that's gone from 10 up to 50.
Yes, it is intended that we spend more money in relation to immunisation. For example, you'll be aware, just by way of a couple of examples, of the broader RSV immunisation programme that we have, which we will maintain. That, excuse me, we have extended the HPV vaccination to 5th and 6th years as well.
This is a substantial increase, so we obviously must be, and I think it's important that we get the information out there on time as regards making sure we have full use of whatever immunisation programmes we're doing.
You're right, Deputy. And this year we were pleased to see a very significant increase in immunisation uptick rates. So, for example, for the flu vaccine that we had an increase from 17% of children to 25% of children in the end. Obviously, I would like it to be 100% of children, and so we make that provision, of course. And in particular, if I could say, this year, 2026, more than any other year, is the most important year for immunisation to reduce flu and respiratory illnesses, because of what we hope will be the move from the Children's Hospital and reducing the pressure on the hospital system more broadly. Can you please?
And I know, just talking about, immunisation obviously helps the whole health system as regards reducing issues that then arise. Just on that issue, the whole issue about about reducing the time people are waiting inside an accident emergency departments. Last week I raised the issue about, say, for instance, the minor injuries unit in Cork is really the minor injuries unit in Cork is a really successful unit in that from the time people go in and are fully treated and discharged is on average between 2 and 3 hours. What I'm asking for, this unit has proved to be successful. We don't appear to have a programme of developing further minor injuries units around the country to take them away from accident and emergency departments and get them seen in a very timely manner. And I'm just wondering if that's going to be looked at. And I suppose that the next issue I want to raise is, and I know we're talking about the surgical hubs and being rolled out, the issue about the elective hospital in Cork. We're not even gone to planning at this stage. And even if we went to planning in the morning, it still would take us 3 years before. So we seem to have parked that issue where we have an increasing population in Cork/Munster area. Therefore, we need to plan to cater for the growing demand of services.
In relation to the injury units, we have 15 such injury units around the country, and we will open 4 more this year. You're right, they are extremely successful and a very important hospital avoidance measure. Can I pay particular compliment to Cork University Hospital, who also have a virtual urgent care hub where they are able to provide support to GPs who are on the margins of whether to send somebody into the emergency department or not. This has also proved an extremely successful and safe hospital avoidance measure, which is very important. In relation to the elective hospital, of course, we will deliver the surgical hub this year. I understand that the particular difficulties in relation to the planning, which had been rooted in Cork County Council as regards the connecting road, have been resolved, and that we will be in a position to go to planning. But if I may, could I bring Derek Tierney in on this?
Yeah, sure.
Is that okay, Chair?
So there's no rowing back on our commitment for the elective treatment centre in Cork. So as committed, we will get the planning application by middle of the year.
Sorry, am I right? By the end of the year?
By the middle of this year.
But why can't it be being brought forward if the issue with the County Council is resolved?
Because we've completed design for the planning application, Deputy.
But in fairness, we're dealing with this now nearly 5 years.
Right, I'll take it.
Why should it take another 10, 12 months to get it into planning? Because once it goes into planning, it'll take another 12 months after that.
Well, I hope it doesn't, and I hope that Cork County Council will be able to expedite it, considering that the difficulties have sat there for some time. But I'm very pleased that they have now been resolved.
Well, it will be 2 planning authorities now, because we're dealing with Cork City Council and Cork County Council, because as I understand it, so it'll be a complicated application. So I'm just wondering.
Indeed. So I'm sure that because both Cork City and County Council have been so seized of these issues for so very long, and the connected road issue that seems to have blocked the progression of this planning application, that they, Cork City and Cork County Council, will put their best resources together to expedite as best they can the appropriate consideration of this planning application, because we're very keen to go ahead.
Because this is an elective hospital not just for Cork but for all of Munster. So I think it's important that we forward plan that. Just finally,
we're over time. And
can I just one
very briefly,
very quickly, in relation to people being admitted to hospital from nursing homes, and it was rolled out very effectively in Dublin, where rather than people being admitted from nursing homes into hospitals, there was a system in place where the hospitals would have a team that would call to the nursing home, and as a result there was a 90% reduction in the numbers of people being transferred from nursing homes. Is there a plan to roll out that in all of throughout the country, so that we can reduce down the numbers?
That's my expectation for the regions. Yes, they should be doing that already.
Thanks very much. And we'll have time to come around for a second round of questions. If people have additional questions, there should be time on the agenda for a second round. I have a number of questions at this point. Minister, I want to start with the HC briefing this morning on the NICAM report. It's been described as a case study of neglect of international proportions and quite significant in terms of what has happened at CHI and the orthopaedic unit in particular. And what I expect will happen now in the steps forward, there will be debate going back and forth. Some deputy, us calling for you to publish the report, you say you can't publish the report, and back and forth. And what I worry about that process is that we lose sight of the children, the patients and the families and the people directly affected in that. And there's a saying that says, you're only as sick as your secrets, and I think that also applies to public services, and sunlight is a very good disinfectant. So I would say that as much of this needs to be published and put in the public domain as quickly as possible. What I want to focus on is the process here, because I think my understanding, and from what I can see, I think the process has been very poor. Parents were first contacted in October 2023. Your predecessor, the previous Minister for Health, said that phase 1 would be completed by April 2024. We learned this morning that it would be completed by the end of this year, so almost 3 years later. So I'm quite concerned about the process here, the delays, and the impact that's having on families. So maybe just like your comment, Minister, in terms of the process and that timeline and the delays we're seeing, given that commitment that will be done in April 2024.
Deputy, I can't speak to that because I can't speak to the experience that the reviewer had in the conduct of his review with the clinician, though quite a number of issues have been in the High Court. Can I just say, Deputy, that I would very much like to publish this report. I'm sure the committee would very much like to publish the report. The committee is, of course, entitled to make an application to the High Court if it wishes to, in the same way that I would try. You have all of the same challenges that I have in relation to this, and the same intent. I believe sunlight is a disinfectant as well, and I would very much like to see this published. What I do believe will be ultimately helpful is that this report hopefully will form part of the inquiry that we are ultimately establishing to shine light on all of these different practices, because I agree with you completely. Nevertheless, you, like I, am constrained by the rule of law, and I have to be very careful. I was not a party to any of the proceedings. It is for the reviewer to describe difficulties that he may have encountered along the way.
And you mentioned this relates to the public inquiry, so will the delays here delay the public inquiry?
No. The inquiry will proceed along as quick as I possibly can, because that is the commitment that we have made. What, of course, I would like... In
the absence of the report?
What I would hope that the report would become available, but we have to have... Would you prefer that I delayed the inquiry, hoping to get the report and hoping to be able to publish it and give it to the inquiry, or would you prefer that I establish the inquiry and then hoped that the report would be able to be made available to the inquiry at the earliest juncture?
Would have liked to see this concluded much earlier.
Well, of course, but they're the two choices, so there isn't a third choice. Which would you rather I do? Because I think it's better to progress with the inquiry and try to make everything available to it that I can make available to it. The good, I don't want the perfect to be the enemy of the good here. They are binary choices, both imperfect. I have to make one of them. I think it's better to progress.
So your commitment is to publish as much as you can?
At the moment, I cannot publish anything. I want to move ahead with the inquiry, and I want to make everything available to the inquiry as I want to make it available to everybody. And I will do the best that I possibly can within the constraints of the rule of law to try to achieve that.
And this isn't the only report that's pending. You know, there's the Dixon report that hasn't been published, the audit into waiting list management. Like, are we going to see those other reports?
So
the
audit into waiting list management hasn't been completed yet. I expect precisely. I expect it. I have. I hope that I will have this. That was to be into 3 areas: spinal, urology, and respiratory. I'm hoping that I may have one of the elements of that by the end of February and be in a position to progress with that. That's my hope.
And what was the delay on this, on the audit?
The access to information
from CHI. And I think just these continuous delays in these reports is unacceptable, and I think it's a real cause of concern for the committee and in particular for the parents and families. And what I want to move on to is the parents and the families. So I understand a letter has been issued to the 91 patients this morning. What other supports be put in place? Is there a phone line people can engage with?
So 2 things. Parents, excuse me, please, sorry. Parents will also be phoned this morning, in addition to receiving the letter. And then obviously people miss phone calls because, you know, you're not expecting them, you're at work, you're going about your day. There is also a phone line which is being staffed by an assistant director of nursing who can take calls from parents as well. So that number is there in the letter as well. So we're trying to find ways to make sure that we're reaching people where they are, either by letter, a proactive phone call, and also a phone line staffed by a senior member of staff to be able to take calls and give support.
And I understand
I hope that will meet people's actual lived reality when they receive the letters.
I understand that 62 of the 91 patients will need follow-up.
That's what the clinician has
and is there a timeline in terms of when they will receive these follow-up appointments? Or
so that's what we're trying to create this week, that they will have a consultant to be their consultant for that ongoing follow-up. It entirely depends on the clinical situation of the child. Some may need some measure of check-in and follow-up. Others may need more ongoing follow-up. Some are already in the system in a follow-up process. It will entirely depend, excuse me, on the circumstances of the child.
Thanks, Mr. I want to move to the Children's Hospital. Last week, the CEO of CHI said that April 30th was the latest completion date, the 18th delay to the hospital. This was confirmed in the letter, your letter to the committee minister, which we received yesterday. The CHI CEO also said that the commissioning of the hospital would then take 7 months. Minister, your letter says that senior reps from BAM UK and Ireland and members of the Royal BAM Group are now involved in the project and are reviewing BAM Ireland's progress. However, workers on the sites have dropped. In December 2024, there were 900 productive staff on site. December 25, just over 500 productive staff. At the week ending the 30th of January 2026, staff dropped by a further 82, a reduction of more than 15%. To meet the new deadline, BAM would need to deliver 450 rooms per week on average, doubling what it's currently doing. Yet in the first week of February, just 90 rooms were completed. And given the substantial completion date for the new Children's Hospital has been delayed 18 times now, Minister, how confident are you that the April 30 deadline will be met?
That's up to BAM. That's up to BAM and how they show up and whether they bring people to finish it or not. And I cannot be more transparent with the committee and with the Oireachtas and with the people of Ireland than to point out the reduction in the number of staff that have been there. We did see a step up in October when there was a new person appointed to try to finish out this hospital. Unfortunately, that person had to step back, but they really didn't meet their commitment since then. We obtained early access to the 6th floor in December. Can I assure everybody that CHI worked so hard to maximise that resource, to maximise access. Everything has been cleaned appropriately, the flooring put down, that really matters. Beds have been moved in, computers have been moved in.
We understand that, Minister.
And in addition to that, though, where we realised that there was a day or two slippage by BAM, they used that space to do other things, to construct other machinery that would be necessary for the rest of the hospital.
What I want to know, Minister, is what are you doing to ensure that BAM meets its obligations to deliver?
Can I ask you, what do you believe is within my power to do, Chair? What are the procedural tools that are available to me? We have a contract with BAM, who have missed their deadlines again and again and again. Their deadline with the Irish state, who is the customer. I have provided evidence to the committee of the detail and the reasons for that. I have challenged BAM, as has my predecessor, both privately, in the media, in public, by way of letter, by way of update to you, to provide clear evidence as to what needs to happen for them to finish it. If we were in a commercial arrangement and we were building a factory, for example, and the contractor didn't put staff there to finish the factory, there would be a consequence. If somebody is building a house and the contractor doesn't have staff or doesn't have a plumber or whatever to finish it, there would be a consequence. This is the same thing. The Irish state is the customer. And I'm asking you, what tools do you believe we should take levers? Now, the Development Board do have some tools that are available to them, and they have taken some steps within the Irish courts to try to exert maximum influence on what is a commercial entity that should have delivered the contract for the Irish state.
So, Minister, if you're saying there's nothing you can do to ensure delivery, do you?
No, I'm asking you what you believe I should do.
You haven't given us any examples of things you can do within your power.
One of the things that I can do is be very clear.
Minister, let me put my question to you.
Forgive me.
If you're saying that there is nothing additional you can do beyond writing to BAM and meeting with them as the previous Minister did, do you accept that the contract signed by the previous Minister for Health, Simon Harris, is fundamentally flawed?
I would not sign it. I don't think we would take, with the current projects that we are moving forward, we would not have a similar contractual structure. And I think we will see that in respect of the National Maternity Hospital and other major projects that we will be advancing. May I ask Derek Tierney to speak to the tools that the Hospital Development Board have been able to use, some of the procedural tools within the contract that have been available to us.
Just, Minister, I'll ask you a question on that. Do you accept that the contract signed by Simon Harris?
No, I don't think that's not what I'm saying. What I'm saying is that we would not take that step again, and we will be taking a different step in respect of the maternity hospital.
Mistakes were mistakes made in the contract?
I'm dealing with today and finishing out the contract as best we can.
But it's relevant to today because it's meaning that we're not getting hospital delivery on time.
The contractual structure is not one we would approach again. Is not one we would adopt again. I think it's important to hear the tools that we have.
If the hospital is handed over at the end of April, will patients move in 7 months later in November, December, or what's the timeline?
If the hospital is handed over at the end of April, and if everything goes well with the commissioning period, and we really have worked hard to try to make that as tight as possible, then that would be my expectation.
Thanks very much, Minister.
Can I answer about the Hospital Development Board?
Just briefly,
the legal process.
Yes, under the existing contract provisions, the Board have withheld payments. They have applied LDs. They've brought liquidated damages. So if there is a delay by the contractor and there's a true economic cost realisation as part of that, the Board have an entitlement to apply liquidated damages. And they've also sought to bring their own client-side claims through the dispute resolution process. And if I look into, as we go forward, we have adjusted the contract term. So we have taken the benefit of our experience in this programme in terms of the design, independent reviews, business case reviews. We have adjusted the contract term, so we are increasing.
We can come back to this issue, and no doubt other members will have questions on this as well, so we can come back to it. The next slide is for the Labour Party and Debbie Sherlock.
Chair, and thank you, Minister, and to all, to the 3 ministers, apologies, and to all the officials, the 4 ministers, apologies, and to all the officials here today. And thank you to the Department for the briefing this morning. I think we all want the NIAGAM review to conclude as soon as possible for the patients at the heart of it. But I do want to ask, though, about all the other patients who are going through the orthopaedics and neurology and other departments in CHI at the moment. The HICWA report last year set out a number of very clear recommendations. We understand as of this morning only 12 of the 19 have been recommended. So, Minister, I'm asking you, why have they not all been implemented almost 12 months on? Surely that is a concern. Well, I know there are parents concerned about attending CHI and the quality of care that they're getting. So what is the hold up in the implementation of those recommendations?
Well, there shouldn't be any hold up in relation to that, and I might ask Kate, I will come back to you with a detailed update as to the other 7.
Okay, well, I think that needs to be made public as soon as possible.
No problem.
I think there's huge credit to Conor Ryan and his team in RTE for the documentary or for the programme over the past 2 nights. It is made for harrowing viewing with regards to the appalling state of our forensic psychiatric services and the failure of people with very serious mental health conditions in this country. It is scandalous that we've had this new hospital in Portrane open since 2020 and yet only 2/3 of the beds, 2022, and 2/3 of the beds are only operational. And Minister Butler, I want to ask you, because if I heard you correctly this morning, you said that 2 15-bed intensive care rehabilitation units and 2 smaller units are in the process of being opened. But the Vision for Change set out a target of 4 by 30 bed intensive care rehabilitation units. So is the government retreating from the Vision for Change recommendations that were put in place by a previous Fianna Fáil government?
Vision for Change is no longer the mental health policy. It was announced in 2006 when I came into my role in July on 2020. Minister Jim Daly, my predecessor, had just announced sharing the vision, which is our mental health policy.
I appreciate that, Minister, but I suppose my key thing is, so there was a target set out, right, in a Vision for Change, very noble target. Are you saying now that this current government is targeting a much lesser, a much more reduced target with regards to the provision of care? You've seen what the waiting lists are. We shouldn't have had to have a television programme to tell us the state of how bad the services are, and there seems to be very few places being put in place to meet enormous demand out there.
I'll address it really, really quickly. So in 2022, the Central Mental Hospital moved from Dundrum to Portrane. 93 patients moved that particular day. Today, as I sit here, there's 114 beds open. Last year, I secured 41 whole-time equivalents to open an additional 18 beds. 2 opened in December. The other 16 will be staged open in February and March of this year. In budget 2026, in relation to the ICRU, we have 2 ICRUs already, intensive care rehabilitation unit. These are at such a high level for people with enduring mental health conditions, specialist care, a risk to themselves and to others. So this is not the norm. This is a small cohort of people who need these supports. So we've 1 ICRU in Dublin and we've 1 in Cork. So we have 2 buildings in Portrane, the most amazing facility in the country, right? And 15 beds in each intensive care rehabilitation unit. I have funded the opening of 10 beds this year, which is 30 staff. Now, these are specialist staff. These are not just ordinary mental health staff.
No, I appreciate
because
that,
it's difficult to get them. But can I just say one point? I worked with the National Forensic Services. I allowed them recruit last year, not through the HSE. The 41 staff have been recruited. Okay, which is really positive.
And I appreciate all your efforts, Minister. I really do.
In order to
the numbers
so
here.
I will answer your question. So what was looked for in 2006 is different to where we are in 2026.
Do you think there's a lesser need now?
No, I'm not saying that. But what I'm saying is a Vision for Change was uncosted and it was unfunded. I'm dealing with sharing the vision, and the difference with sharing the vision is there's a National Implementation and Monitoring Committee that sits over me, sits over the Minister for Health, it sits over the HSE, and they meet regularly. And they have a website, and we produce documents every quarter showing exactly what we're doing in relation to the short, the medium and the long-term views. But just, I know I'm taking up time. There's 36 on a waiting list now. There will be an additional 28 beds, 26, 2 opened in December, so 28 beds in total, new beds will have opened, and that will bring us to 140. I will go back into the estimates again in September to secure more funding for the ICRU. If I had all the money in the world this year, I could not open all the beds because I couldn't get the staff.
Okay, so I just want to be clear, right, because I see what's in the opening statement is what's being committed to in the service plan, right, the HSE service plan. Are you telling me that the government are not responding in any shape or form to what has been revealed to the public over the past 2 nights?
No, that's completely inaccurate.
No, but has there been an updating of the position on the service plan?
No, but long before this programme ever started, my focus has been on opening new beds so that people who are currently unwell can access the hospital and the specialist support they needed. But we also need community supports. So we have 1,200 people currently living with enduring mental health conditions across the community. We have 500 people, plus 500 people, who were rehomed in the last 18 months, working with the Department of Housing. And, not every community wants somebody coming in to live beside them with enduring mental health conditions. So you have to make sure they have the correct wraparound supports. But what I'm saying at the moment is this is a whole of government approach. It's not only mental health, it's the Department of Justice as well. And if you were to ask my honest opinion, I genuinely believe that there has to be a layer in between national forensic, people in prison who might have low-level mental health issues. And I do believe in the programme for government, there is a request in the programme for government that there should be a wing in a prison which is an approved centre as against a prison, and and the people that are, so if you're a prisoner at the moment and you refuse, to take medication for your own health and well-being, it cannot be forced.
No, I appreciate that,
that's
Minister.
why I believe.
But I suppose the thing is, because of the lack of services, right? Okay, people are ending up being held indefinitely.
No, there's not a lack of services. But what I'm saying to you is, no. So we have a waiting list of 36. That waiting list has grown.
Sorry, but if I develop psychosis in the morning and if I go and punch somebody, right, I could end up in remand indefinitely because there's nowhere else to put me.
Yes, but there's many people in prison who have committed crimes.
But there's a difference between a minor crime because of your mental health condition and actually murdering somebody. And that's the critical thing here. People are ending up in jail because, you know, of disorder. But somebody was talking to the wall in Dublin Airport and they ended up going to jail.
What has been lost in the programme is that the Central Mental Hospital is a hospital for people who need forensic care. So we also have people who don't come through the justice system, who've endured mental health conditions, who might have been institutionalised for 30 or 40 years, and who are a risk to themselves and others. And they need a pathway as well. And I have to protect that 10% who need a pathway into the hospital as well. It is a hospital. The Central Mental Hospital is not a prison. I think that's where the confusion is happening.
There's two separate but related issues here, Minister. But I suppose I'm not confident from listening to yourself that by the end of this year that we're going to have the supports in place for those that need it with severe and enduring mental health conditions.
I am confident.
I need to ask another question.
Just finish on this. I am confident that we will have an additional 26 beds open by the end of this year. But also, it has to be respected that there are 580 staff funded to work in forensic mental health services, and there is outreach into 10 of the 12 prisons across Ireland, and we will expand it to the other 2 as well. And I'm happy to take this offline and have a meeting with you to discuss it. If you'd be happy to do that.
Happy to do that, Minister. Just want to say 2 things. Firstly, I'm now relieved that we have confirmation that there has been a cut to the Drug and Alcohol Task Force, because obviously there was confusion about that. But I want to put a question though in the last minute. The EU presidency this year, Minister, what are your priorities for that? You're going to be chairing the Council of Health Ministers. What are your plans for that?
So there's 2 pieces of legislation that are of absolutely critical significance to both the complete EU mandate for that period. That's obviously the Biotech Act and the Medical Devices Update.
So we are hoping. So I'm interested to hear if you're going to say anything on drugs in terms of because we have an EU directive that's been stalled at the moment, and we understand the Irish government is opposing it. So is that going to feature in terms of the? That's
just the ongoing piece of work. But in terms of you're asking me about the presidency, our priorities are to try to make as much progress on those 2 pieces of legislation as we can. There's a lot of expectation on us to do that because we're being preceded by Cyprus and then Lithuania on the other side, who just wouldn't have the same depth of experience, A, as EU members, or B, as within those particular fields. So there's a lot of expectation.
What will
Ireland
has to be get out of those 2 initiatives, I suppose?
Well, a different regulated system for clinical trials, a different regulated system for access to medical devices. It's a huge part of the competitiveness agenda as well. Medical devices, life sciences within Europe, and bizarrely the competitiveness agenda at the moment within the Irish presidency actually falls to health. There's then also the vascular, the Safe Heart, the vascular plan that was published by the EU in December. That will also form a theme, though it's not a legislative theme, and our sort of conference events will be around the 2 major pieces of legislation where Ireland has to take the lead to drive as hard as we can to make sure that we're making a difference for access to clinical trials, access to better regulation, simplification of medical devices across the board. That's hugely important for patients. It's also hugely important for the Irish economy, though, as you know, Ireland will of course be adopting a neutral stance as the chair, as President of Europe at that stage, but our priority is to make the best legislative contribution and get those pieces of work done. Very technical, but that's the way it is.
Our next slot is for Fianna Fáil, Deputy O'Sullivan.
Sure, and welcome all ministers this morning. Minister, in 2 weeks' time, it's Rare Disease Day or Rare Disease Week, and I know it's a thing. I can see Minister Butler nodding away. It's something that I bring up regularly. So can I just ask, in relation to the programme for government commitments, specifically on an early access programme or developing one, and secondly, a review of the reimbursement system in its entirety, can you answer me what progress you've made in that regard, or where you're taking that? It's 12 months in, and by the time we instigate that review, I'm just worried it's going to take a significant period of time, and I just don't want us to miss the boat.
So that review has already begun. I think we spoke about that when I met deputies with an interest in rare disease, and we spoke about some drugs in particular. So that work has already begun, and as you're aware, officials from my department are examining what other models in Europe are working and not working and how we can best apply that. I'm sorry, I don't have a date for you at the moment as to when that will be completed, but it has already begun. I'm sorry, I don't have a date for the completion in relation to that.
I just ask specific to the early access programme. Again, I'm only reading stuff in the media, and it might not be true, it might not be accurate, but there's a suggestion that the early access programme specifically might only deal with cancer drugs. Can you say if that is the case?
I can't speak to that, because that's not information that I necessarily have. You know what I mean? That is just speculation. We haven't completed a programme in relation to what that would look like. But I think what you can see from the department is a real focus on all of the different areas that are supportive of people with rare diseases. So, for example, the genomics and genetics piece of work that is happening, the rare disease strategy itself, the beginning of clinical trials in different ways. So there really is a commitment to try to do more in this space. But I wouldn't be able to, I don't have information that would suggest that is so in relation to early access.
Look, whether it is or not, you don't know, you've just said, and I don't know, but I would just implore you that if that is, I would ask you just to bear in mind that there's a wider net of...
Yes, it wouldn't be my intention that would be the structure, but as I said, it is a body of work that hasn't been completed. Okay. But I would certainly personally look at it more broadly than that. I think being very honest with you, where our real challenge is going to be is in relation to when we have this new structure in relation to the 180 days that we have agreed and that we're investing money in, that there are constraints on our drugs budget. We do have additional funding this year for new drugs, as well as additional drugs, money for additional drugs. Our drugs budget, we will never be in a position where we can say yes to everything straight away. We will never be in a position where we can say yes to everything at the first price that is offered to us by the pharmaceutical company. We are always going to have to try to negotiate to get the best value for the Irish people through the Irish state, through negotiations with pharmaceutical companies. And if I may say, just because, and this isn't related to rare diseases, just because there are allowed campaigns run by different drug companies in favour of their drugs does not mean that the Irish state will buy them at any price.
And I think most people in this room are grown-ups and they realise the politics of what goes on. That said, I would say the most vociferous and loudest of campaigns are normally run by the parents, and it's out of pure desperation. And you've met some of them, to be fair to you.
And I would agree with you completely on that.
Yeah. So, look, as I said, I would just like us to be a bit more ambitious when it comes to it. And to be fair, since you've come in, you've met people, you've said that you're instigating these different steps, and I appreciate that genuinely. I know families do, but I think now in the next 12 months we need to see a bit of activity and delivery, because, as I said, my fear, and we've been in here in previous governments, previous review of the reimbursement system under the Mazars report, and by the time the bloody thing has started, I'm sure the government is nearly at the end of its term, and I just urge you to keep the pressure on if you could. Can I just move on in that vein in relation to SMA? And I was actually just reading the press release back again in my records there. November 2023, it was announced that SMA would be tested for the heel prick test for newborn babies. November 23. So fast forward to February 26, still not being tested. Have you any update in relation to that? Again, there's been media reports that it's imminent.
Yes, it is imminent, and Deputy, I will come back to you later today with more specific answer in relation to that. But yes, and it's only that I just can't recall the ESOB out of my head. But yes, that is very close, and I will come back to you today with a more full update on that.
And again, this is an issue like that was approved by the previous minister, to be fair to him, something that wasn't implemented for, as I said, the best part of 2.5 years. I don't understand why a minister can greenlight something in November 2023, and we're here sitting in a committee with his successor.
Yes, and I do have an update, and it's only, forgive me, usually I can recall things, but I just cannot recall the exact, but I mean, I have already signed off on an ESOB in relation to that, and I will provide you a much more detailed update today. Forgive me for not having that, I just don't, forgive me.
And again, just following on from that then, and I'll finish with the rare disease piece and that one. We compare ourselves obviously internationally and with our EU counterparts, and in terms of heel prick tests specifically, I think Italy are kind of streets ahead of most of the continent at this stage. In parts of Italy anyway, they test for I think 20 or 30 different rare diseases from birth, and I think at the moment we test for 10 or 11. Whether you take it that we're testing for SMA or not, at the moment we're not, so I won't count it. So I think 10. is there any plans to roll that out further beyond SMA and to capture more rare diseases at testing stage?
Yes, that's absolutely my intention, and I've already had that conversation in relation with excuse me, with the Chief Medical Officer. Can I just, the heel prick test will be extended in April. Sorry, I'm just trying to get an update for you as quick as I can in live terms. I will provide you with a full update today, Deputy.
If you don't have the information, that's fine. I'm happy to take it after.
Yeah, sure, no
I do
problem.
appreciate you coming back.
Yeah, I'll even come back before the end of committee. I just need to check. Forgive me.
Appreciate it. And can I just move on to flu vaccine and RSV, because I've raised it here the last few weeks. I raised it with Bernard Gloucester when he was sitting in that chair. NIAC has recommended, that the RSV vaccine will be expanded to an older patient cohort. They've done it in Scotland. The evidence there suggests it's dramatically reducing the number of hospitalisations. I spoke to Bernard here last week. It was his last occasion coming before the Health Committee, and I wish him the best of luck in his retirement. He was a good man and great to come back to us. But that said, the news that he gave us that day was fairly disappointing. He more or less conceded that there was no plans to expand the RSV vaccine into that older patient cohort. Can I just ask, what information you have in relation to that, what plans you have for that? Is that something that you can revisit or look into? As I said, it'll reduce the number of hospitalisations. I know there's going to be a money and financial aspect to this. As you said in your piece earlier, I don't expect you to sign off on every drug and every vaccine.
Sure.
But specifically to those ones that kind of make sense, that, as I said, that reduce hospitalisations, I think it needs to be looked at.
Yeah, sure. And you appreciate when I made that point earlier, it wasn't for you directly, it was for those who might wish to engage in such campaigning from a commercial perspective. But in relation to flu, RSV and COVID-19, I have to say that the RSV vaccination, the take-up rate in the maternity hospitals where we've provided that was exceptionally high, it was close to 88%. And it was incredibly impactful in reducing RSV and the severe illness that we had seen in the previous 2 years in babies and in children's hospitals. I will speak with the Chief Medical Officer in respect of its extension, but her bigger concern was the vaccination rates, the flu vaccination rates more broadly. We did see at one stage that, and I don't want to say this for the whole flu period, but at one point the analysis showed me that 3/4 of the people who were hospitalised with flu, and it was a very severe flu, had not had the vaccination. We did see that there was very high uptake of the flu vaccination in those over 80s, because of course we have a nursing home programme, very good rates in the over 60s, improved rates in children, though it is a mystery to me how only a quarter of children with a free vaccination, only a quarter of children, here we are celebrating it, that it's up from 17%, but it's only a quarter. Most of the circulation and the illness was circulated among children with impacts across society. It's incredibly important to get the flu vaccination at every age, and the rates for healthcare workers were higher this year than last year, but again I would hope that they would be higher again next year and that the vaccination rate would be higher generally. I will speak to the Chief Medical Officer about her perspective on RSV for other people, but we are trying to target the most impactful each year, and as of course you're aware that changes every year with the nature of the presentation of flu. It could be that RSV is more severe next year, so I will discuss it with her.
Just because I have time for one last question. It's in relation to the hospital, the elective hospital in Galway, because I'm listening to it for months inside here. There's stuff going on in the ground which I'm not going to comment about publicly. There are meetings, there have been meetings with landowners and so on, and I've been party to those. Progress is being made. I'd just like to make a point rather than a question. When this hospital was announced a number of years ago, that it was the intention of the state to build this hospital, I would say that a lot of the pre-planning that should have been done, that's been done now and been hashed out in this committee, should have been done then. And it's just a point I'd like to make in the round. We're here now dealing with this. We're here chasing landowners. We're trying to get concessions. We're trying to mediate between people, and it's just to make the point that should have been done 2 years ago, and it wouldn't lead deputies and senators coming in here asking the same questions. As I said, there is progress being made. Maybe some people aren't aware of it. It's not a negative story in the round. This will be delivered, and landowners are forthcoming. But it's just to make that point that a lot of this work could have been done a few years ago.
Deputy, I agree with you, and I also want to thank you for the work that you're doing behind the scenes to try to resolve some of those issues as well. So thank you for that.
Thanks very much. So we have 3 speakers remaining. So what I will suggest at this point is we take a 5-minute break and we come back at 11. We have 3 speakers remaining, then we'll have 30 minutes left for an additional round. Depending on how many people want to come back in, there'll be a short additional round of maybe 2 or 3 minutes, depending on how many speakers we have. So we'll suspend now for 5 minutes, come back at 11, and we'll resume with Sinn Féin. So move to suspension. That's agreed. And my next slot is for Sinn Féin. I've got Deputy Clerk.
Thank you, Claire. And thank you to our guests this morning. Minister Butler, if I could start with you. Most of us will have been watching the RTE Investigates programme over recent evenings regarding the treatment of prisoners with severe mental health illnesses who are currently in prison. Now, it's my understanding that this situation has become almost intolerable, is probably the best word to use, since therapeutic bail was suspended there about 6 or 7 weeks ago. We know the Central Mental Hospital is there, we know how much it costs to build, we know how many people are it's capable of holding, and yet we still have 38 people in prisons who really should be in the Central Mental Hospital. While I acknowledge it isn't fully under your brief, have you had any engagement with the Minister for Justice on this issue? Because I don't think anybody wants to see this continuing. It's unsafe for the prisoners, it's unsafe for the remaining occupants of the prison, and it's unsafe for the staff, and it really isn't best practice at all.
Thanks for your question. It's a really good question, and it is a whole of government approach. So myself and the Minister for Health and Minister Jim O'Callaghan visited Portrane during the summer, because recognising the fact that it's justice and mental health and other elements as well. So yes, I have, and I've had with the Minister too. We also have a high-level task force in place between health and justice, and you would have heard maybe your colleague Deputy Quinlivan speaking about the cast that we have down in Limerick, whereas when there's an issue, somebody has a mental health challenge, that mental health travels with the Gardaí in relation to dealing with that issue. Now, I know that's in the community, but I suppose the point I'm trying to make is, yes, we have, and there's very good solid communication between us trying to resolve this issue.
Okay, and what resolutions are you examining at the moment? Because there's 55 recently in Clover Hill on the medical land, and that has capacity for 27. The figures have gone up 10 times over 10 years and have tripled in the last 4 years alone.
I can't answer the questions in relation to the capacity in prisons. I do know in this year's budget the Minister has secured support.
These people should be in hospital.
But I do know the Minister has secured support for an additional 600 to 700 prison places. We have the outreach. We have over 45 mental health staff that are doing outreach into the prisons. So 10 of the 12 prisons have the outreach. So I'm working now to find out why the other 2 prisons haven't. But I do accept and Deputy Sherlock's comments in relation to the challenge it is when you are psychotic and you're inappropriately placed. Yeah. I get that 100%.
Yeah. Okay, and just on the subject of mental health again, in terms of, and I recognise government didn't oppose the Sinn Féin motion on the emergency departments and the need for a specialised space within those areas. Those emergency departments, those 8 of them where these rooms don't exist at the moment, and I'm looking at a parliamentary question reply here regarding the National Clinical Programme for Self-Harm and Suicide-related ideation, also identified some deterioration in the quality of remaining EDs that were audited. In terms of the estimates, how many more of these rooms will be delivered in our emergency departments?
Well, I expect all of them to be delivered.
Is the funding there?
Well, I would expect them that they would be able to pivot and like emergency departments are very, very busy places. A lot of money has been provided to them under capital funding. But like I don't. It's not an issue about funding. It's them to identify a place and to make sure, because emergency departments are not the ideal place for anyone who's presenting, who are psychotic, who has a mental disorder, who are very unwell. The last thing you want is to be sitting under the lights. But we're down to 8 hospitals now that haven't provided it. Limerick is one of them, and I spoke to the REO recently in person about I have zero tolerance for not having those rooms in place. So I'm going to continue to work on that. I have secured 470 million in capital in the National Development Plan for mental health, unheard of funding out to 2030. I've never had a budget like that before, and so it won't be an issue in relation to if it's a small amount of capital to facilitate a room. That won't be the issue.
Okay, and have you given those 8 hospitals that don't have these rooms, these specific spaces available to them, a timeline to have them in place?
I will be given a timeline very shortly. I want it in place by the end of this year.
Okay.
It is, yeah.
I just want to move on to the gaps that exist in adult ADHD assessments.
Adult ADHD
assessments. It brings me absolutely no joy to say to yourself and to this committee, I had three families.
Say again?
I had 3 families on Monday alone of this week who are living in intolerable situations caring for adult children who are, and these are the most really, really desperate situations. But Minister, they are pleading for ADHD assessments. They have been told that the boxes are being ticked left, right and centre for these, but they're being told that by people who aren't in a position to carry out the assessment. Can you, in terms of the estimates, give us an indication of how the current policy can be extended to fill these gaps?
Okay, so I introduced the policy for ADHD for adults in 2021. At that time, the clinical programme was devised and I was told that we would need 14 teams in place across the country. The 14 teams have been funded. The final 5 teams that were funded in budget 2025 are under recruitment.
And when will they be in place?
Well, I would have hoped that they would have been in place by the end of last year, because an ADHD team, for some reason, is quicker to set up than other teams. And you're normally talking about 5 or 6 staff. So if it's okay with you, I will get a more detailed note and come back with timelines in relation to it. Can I just say one thing in relation to ADHD for adults? This was specifically to catch people so children get ADHD diagnosis now, notwithstanding the waiting list, but there's adults 50, 60. Even I met a person that was 68 that got an ADHD diagnosis because I suppose when they were younger they didn't have the opportunity, or it wasn't there. And the difference it has made, and I want to compliment, and I know you do too, ADHD Ireland, for all the work that they do in relation to that. But I will come back to you in relation to the timelines, because it's something I really want to push.
Is there a policy change? Is there a tweak that can be made specifically in those areas where the teams aren't in existence as of yet, where they may be funded but they're not staffed, where we don't have the repeated scenario of people meeting brick walls because they don't have the finances available, the €1,500, €2,000, whatever it may be, to pay for a private assessment, that they could be referred to an existing team?
I think it should be able to be free up, because previously, as you know, we had 9 CHOs. Now we have 6 regional health areas. For example, CHO 5 and 6 amalgamated. So that's from Dublin, Vincent's, all the way down into Waterford. We have no team in the southeast, but there's a team. So I can't see any reason why somebody can't be referred to a team within the regional health area just because they don't fit in the geographical area. If you want to bring me those cases, please.
Well, and I appreciate that. And Minister, if I can just bring something back to you, and I will fully acknowledge that in the scale of things, this wouldn't be the most high-profile issue, but it is something that really, really annoys people. And I raised it with you last summer. It was around the emergency supplies scheme and the virtual appointments that people are being offered in hospitals, where they are provided with a prescription, where they have 24 hours to get it repeated by the GP. It's still a problem. It's still something that consistently comes into my problem. Have we any progress being made on this?
That should not be a problem, and you're absolutely right to identify with me again. I did raise it with the HSE afterwards, and I do not have an update for you today, but I will have an update for you by the end of the day.
And I
apologise for not having that for you. You are so right.
I appreciate that, but there is an obvious solution here.
There is.
Where pharmacists should be able to extend the duration of that, because if I leave the hospital on a Friday with one of these things, I'm not getting to a GP before the following Thursday.
And the reality is that it's so consistent with what we've done to extend the role of pharmacies in that space anyway. So we have, and this is where to make sure that this fits into what we've done elsewhere. So we have given pharmacies the power to extend prescriptions in other cases, so that you don't have to go back to a GP. We've even given pharmacies the power to issue prescriptions now in the Common Condition Service. So you're right to identify this. This is a technical piece that should be fixed, and I will update you by the end of the day.
It should be an easy fix and an easy win for everybody involved.
Thank you.
Our next slot is for Fine Gael. I've got Deputy Roach.
Thank you, Chair. And can I say firstly to the AHM, thanks for being here. We appreciate the opportunity to ask yourselves questions, relevant questions in terms of how we're managing, and indeed to the staff as well. And I suppose one of the things that we have to acknowledge every day is our frontline staff and what they do and how they manage, sometimes in a very challenging environment. And I suppose that's the first thing I'd like to say. And I appreciate, Minister, when you responded to me last night in the Dáil with regards to the system, if you like, where people entering into A&E, that they would like, I suppose, maybe directional signage, so to speak, and they would be directed to psychiatric services if they were presenting with mental health issues. And I really take what you said when I mentioned that true pathway system and the crisis resolution teams, and you referenced the 9 Model 4 hospitals and the 1 Model 3. I suppose the short question I have for you on that is, when would you anticipate that would be rolled out nationally? And that's the first part of it. And then in terms of the community crisis teams, then are there a community crisis team in every county?
Okay, thank you very much, and thanks for your persistent and positive advocacy in relation to mental health. I do really appreciate and working with you on that. So, as we know, there's the budget this year in relation to mental health pivoted to really focus on crisis presentations, self-harm and suicide ideation. And as I've announced in the budget, I secured 300 whole-time equivalents. It was the most that I ever managed to secure. And I want to thank the Minister for her support on that. So what has been announced is that 40 staff are being made available to 10 emergency departments. So the 9 Model 4 and 1 Model 3, which is Mercy Hospital Cork, because they had over 1,200 presentations last year. So it was done on data. So CHN, clinical nurse specialists and advanced nurse practitioners will be employed specifically out of hours to support the non-consultant hospital doctor who is in the emergency department at that time, to support them. So to make that initial difference. And this is on foot of, I suppose, 2 things. Professor Lucy of the Mental Health Commission doing his report and audit in relation to emergency departments. But I also met with the ECDs, the executive clinical directors who sit over, I suppose, the clinical directors, and one of them was from the Galway region, mentioned a specific case at that particular time, a high-profile case with an anniversary at the moment, and I want to acknowledge the distress the family have gone through. And I do think this will make a significant difference. In relation to having a separate pathway, it's quite difficult. Because in some areas, for example, you take University Hospital Waterford, and Galway is the same, there's a department of psychiatry on site, part of the hospital. In other areas, they're not part of the hospital, they're part of the hospital campus. And so it's to find the right fit. So what we're doing in relation to crisis resolution teams and crisis cafes, because we have seen that where you do have crisis cafes, we have seen an 18% reduction in the amount of those presenting to emergency departments. So Budget 26 will have 3 new crisis resolution teams, and I acknowledge the Senator from Donegal there in the back who has come in. So we'll have a new crisis resolution team in Donegal, we'll have a new crisis resolution team in Kerry, and we'll have a crisis resolution team in the Midlands, because these have level 3 hospitals that are under pressure in relation to presentations. My first ask of Budget 2027 will be to expand this to the Model 3 hospitals. So we'll have the Model 4 this year, so 10 hospitals, and then we'll have the Model 3. But also, can I just say, so the regional health areas and the new REOs, the regional executive officers, they all have got their contingent of staff from the Minister. There's absolutely no reason, if they want to decide themselves, that they want to put additional staff for mental health into Model 3 hospitals or emergency departments. If they want to put more into, I'm after securing the funding for 4 for each of the emergency departments, but if they want to do more, they can absolutely do that. They have the power now within their own budget to expand it out, and that's part of it. I think we have to be leaning on them in relation to that as well, to do more in relation to mental health.
Okay. You mentioned earlier, Minister, in response to another Oireachtas member, that if you had all of the money available to you this minute, that you wouldn't be able to fulfil your plan because of our human resources and employing or otherwise the appropriate and suitable qualified people. If I could, I think one of the disadvantages in coming in late to ask a question in the rota is that some of the questions you might have had are gone before you. But in terms of CAMS, one of the things that I'd be passionate about, I suppose, is that, and sitting on the Education and Youth Committee, and also on this, In terms of early intervention and the assessment of needs and CAMS, there is a considerable piece of work to be done there. And I'm just wanting to understand, in terms of I suppose, your vision for people to have early access to early interventions or early assessment, if you like. Can you just talk a little on that?
I can, of course. So we've 81 teams, 81 CAMS teams currently. We've 76 general CAMS teams, and we've 5 eating disorder teams for CAMS in place. We've about 760 people working across CAMS, about 80 consultant psychiatrists. I took to the road over the last 6 months before Christmas, and I visited 21 teams, the length and breadth of the country. I went as far as Donegal. I went all over the country. Started in Cork. Went into Limerick. Went into all the various regions just to see how. I'm funding CAMS to the tune of 170 million a year out of the budget. An additional 30 million was provided over the last 2 years, and the waiting list only went in one direction. Now, I have to recognise that we've never had as many referrals, and we've never had so many complex cases, and that young people are receiving the support of CAMS for much longer than they needed previously. But what's frustrating for me is the difference in the level of referrals made to CAMS areas, to CAMS teams, and some CAMS teams accepting maybe only 35% of referrals, other CAMS teams accepting maybe 65% of referrals to them. Not all teams adhering to, I suppose, the standard operating procedures. But I do have to give a shout out to the Limerick area, for example, who have reduced their waiting list in relation to CAMS to 3% of the entire waiting list in the country. And that was a dedicated approach taken by putting a clinical director in charge of all CAMS teams, and they managed to reduce the waiting list for those over 12 months by 89%, but those under 12 months by 59%. And I also do want to give a shout out to the Cork Kerry area, who have carrying a very weighty CAMS list of 28%, but have managed to reduce it to 24%. And I have, in fairness to the REO there, Dr. Andy Phillips, he has put in place a structure. Part of the structure is we have 570 young people at the moment waiting for an ADHD referral. And we are working very, very closely with the HSE. We're going to use the waiting list initiative this year to take those 570 young people off the ADHD waiting list all around the country, specifically to get rid of those that are waiting over 12 months. Young people with ADHD, consultants tell me, I'm not a clinician, but consultants tell me that when they get a diagnosis, when they get the appropriate medication, they can manage really, really well, and they can be referred back to their GP in the area, once the blood tests and everything are in order. So my vision is to take all those long waiters for ADHD off the waiting list, to see more joined up thinking among CAMS teams. So for example, Cavan and Monaghan has nobody waiting in relation to CAMS. Great work being done by Lucina, for example, in the Kildare regions. So if we could replicate really good practice across other areas. But I just want to say one thing. CAMS has taken a hammering over the last few years. The morale is very low. I visited teams and I walked out of it and I said, I'll never be able to turn this around. They were so upset and distressed. And, an awful lot of people do an awful lot of really good work working with children who have mental health illness and challenges. And I fervently believe, because I'm always the person who the glass is half full, that anybody working in mental health services, all 12,000 of them employed by the HSE, go in to do the best work they possibly can every day. And I just want to give them a shout out today, because they are in the eye of a storm in relation to psychiatric care for adults. Some of the cases going back many, many years. And they will be in the eye of a storm again in relation to a report I received in relation to North Kerry CAMS over the weekend. So I just want to reference the staff and all the really good work that's done. Thank you.
Thank you. Quickest 10 minutes of my life, Chair.
So
I had more, but
we've one.
I can talk to you again.
We've one final speaker on the first list, but before we take that, we might just get an indication of who wants to come in on the second round, so we can decide how much time to assign. So we have 1, 2, 3, 4, 5, 6, 7, 8. Great. So Deputy Cahill. Yep.
I just want to correct something in my opening comments at some stage, just some figures that as I was reading them out, I knew they were wrong and I checked them.
That now,
thank you. It's just in relation to the reduction in trolleys from 2024 to 2025. As I was reading it, I knew I was saying it wrongly. The reduction in Dublin Midlands was 24%. The reduction in Dublin North East was 23%. The reduction in Dublin South East was 11%. The Midwest was 10%. The South West reduced by 9%. And the West North West increased by 10%. I knew as I was reading I was saying it wrongly, so I just wanted to clarify that. It was that was a bad.
Yes, Mr. Take Deputy Cal.
Yeah, good morning. I'll start with the ambulance service and stroke cover in the Carsavine area. And don't get me wrong, it's I know the personnel involved there, and they're top class in fairness, and it's just that, you know, when they're on another call, patients are waiting up to 4 hours. You know, ambulances are coming from outside the county, from as far as Wales, Clare and Limerick and Cork and so on. And can we do something in that area? It's a vast area, very rural, a lot of areas very remote. In regards to the ambulance service as well, I've been calling for an ambulance base in Cloughlin to serve the Cloughlin, Meath-Kerry region. Can we try and progress that? And also the relocation of the ambulance base in Carsavine town.
Deputy, one of the most important things that every ambulance service needs is a help system at the hospital, which is the ambulance handover team, and it's very important that it's in the southwest as well. I know that you will have had the opportunity to discuss this with Bernard Gloucester when he was here on the National Service Plan, and I will follow up with Bernard Gloucester in relation to that. Perhaps Derek Tierney, if it's all right, Chair, may have something he wishes to say.
Give some confidence to the Deputy. So we are looking to, or working with HSE to review all options for the relocation of primary care centre in Carsavine, and so the site for the ambulance base will be tied to that, so that's under active consideration.
Primary care centre. And
the ambulance base for Carsavine, and we're actually progressing with a design for the ambulance base. And also, I understand HSE still have the ambulance base for Killorgan under review, and are actively seeking a suitable site for that as well at the moment.
Thank you for that, and you've addressed another point that I was going to raise in regards to the primary care centre in Carsavine, and on primary care centres, and I know there has been a hiccup as well in regards to the one for Killarney Town. You push that as much as you can, okay?
Yeah, on Killarney we've 3 sites on the table, so we'll push on. Okay.
South Dock, and again in the Carsavine region, and out of hours, I have had a number of issues that have been onto my constituency office and my secretary and myself in regards to it. Look, just give a look at it, see can we, you know, improve it somewhat. In regards, I'd like to raise again with Minister Butler, CAMS and the CAMS scandal in both South and North Kerry, and I've spoken about this. I've been up in deputations over the years as a councillor, etc. In regards to the look-back review, and I've raised it earlier today as well, the North Kerry CAMS look-back review, that is, and just an update there. And also I'm going to again mention, and I know there has been an apology previously from former Minister for Health. I believe that these individuals, the hundreds and hundreds of children in Kerry and outside, deserve a public apology as well for what has happened, and please God, we will never again see a repeat.
Thank you very much, Deputy. So just to speak about Kerry CAMS, and I suppose one of the advantages of being reappointed to the same role, I dealt with the Kerry CAMS issue in 2022 when we had the Maskey report. At that time there was 240 children, with 46 with significant harm. So just to give an update to all members of the committee, 231 of the 240 children that were harmed have gone through the non-adversarial compensation scheme, and I gave you some of the details earlier this morning. I don't have them here with me this second, but 231 of the 240. The last thing anybody wanted to do was drag these families through the courts. And I have to say, I think it's a lesson for us all in relation to good practice about non-adversarial schemes when the HSE held their hand up that they had got it wrong. At that time, if you remember, I put in place a review and an audit of all CAMHS teams in the country. So we looked at we looked at a list of 55 for each single CAMHS teams, and at that time it was discovered that North Kerry, there was a red flag that 16 of the 55 reviewed were problematic. So I initiated at the time, you'll remember Michael Fitzgerald, he was the chief exec at the time down in Kerry. We initiated a full look back of all cases open to CAMHS as of the 21st of November 2022. My main priority is that children and families would be communicated with throughout the look-back process. That has happened. All families where the potential for harm was identified were invited to open disclosure meetings with the HSE. Apologies were issued and families have been offered support from a clinical liaison support team. My department received the final report over the weekend, and I have seen the report, I have read the report, I have discussed it with the Minister, and I'm just considering my next steps. I will publish it as soon as possible, which I'm saying within the next 2 weeks, mindful that families need to receive it without delay. So the last time I have to bring it to Cabinet also. So what I did the last time was it was sent to all families by registered post before it was published. That's the only way I will do it again, that families have to see the report first. And I will visit the Kerry region in the next 10 days as well for a couple of days. I have discussed this at length with the Minister since I received the report. And so very, very mindful that families first. The report will go to Cabinet, it will be published, and I will go to Kerry, and I would hope to be able to put in place a non-adversarial compensation scheme. Again, I spoke to the Sec General of the Department yesterday. I spoke to the Attorney General yesterday to see is it possible to expand the scheme that we have already in place. That is working. So that's where we're at the moment. What I will say to you is there will be no leaks from this report. The families will get it first after Cabinet sign off on it, and then it will be circulated to the families, and then we'll publish it.
I want to welcome the update, Minister, and just to say, ask that the remaining outstanding cases be expedited. And this has been a horrendous situation for the children, young adults today, many of who are young adults today, and their families. And thank you for the update. While I have you, can I get an update in regards to the free counselling service that you launched there for men there last September with mental health issues? Has there been, what kind of an uptake has there been?
Yeah, I received the figures in the last 2 weeks. So for anyone who doesn't realise it, there's free counselling supports for men now. yourmentalhealth.ie/men. And I want to thank the Irish College for GPs who have partnered with us. I've never stretched 2 million as far as I did. So Exchange House, for example, who provides supports for travellers, won that organisation, who are the retired veterans in Ireland from the Army and the Navy, partnered with My Mind to provide supports in between 18 and 20 different languages, especially for farmers, for example, that might have people in on permits that are working on the land, but they mightn't have access to the correct language, and working with Connect Counselling. So it was launched on the 1st of September, free counselling supports for men, because unfortunately 4 out of every 5 suicides are male. And the numbers I got back were last week that 300 men who never previously accessed counselling supports in their life have. Half of them came through their GPs, and half of them came through actually going on yourmentalhealth.ie/men. You can actually self-refer yourself to the counselling. You don't have to have a referral. You can contact Connect Counselling from 5 to 9, 7 nights a week from the comfort of your own kitchen table. You will receive up to 6 counselling phone calls. And if after that you feel that you would like to meet the counsellor face to face, that can happen. So I'd like everyone to spread the message, anyone who comes into your constituency offices, to know that there are free counselling supports, because the one fear I had was that people who may not be able to afford counselling and needed it would put something else on, you know, put their family ahead of themselves. And so look, we've more to do. We're still spreading the word, getting it out there. But for 300 men who never accessed supports before, I know it's very welcome. Thank you, Deputy.
Well done. That's a good news story, and it's great to see such, in my opinion, it's a great take-up or uptake. Can I ask in regards to, and I've this one burnt over the years really, respite for children and young adults in Kerry. There's a chronic situation there, huge waiting lists, and the plans to provide urgently needed beds. And have we an idea of the actual numbers? I've asked this before in both areas, children and adults.
Is it in relation to children with disabilities?
Yes.
Yeah. It doesn't technically fall under our remit. I'm not passing the buck there. This would be Minister Norma Foley, but we can pass on the question and see can we get an answer for you.
Thanks, Minister. So we're going to move to the second round of questions. As we heard lots this morning, I'm sure people have burning questions on lots of issues. I would ask members and ministers just to keep it tight in time, just so that we can ensure that everybody gets an opportunity to come back in, because I know there are a number of members who want to come back in. So if we can try to keep it to 3 minutes, I'd really appreciate it. And we'll just follow the list as we started this morning. So we'll start with Deputy Jerry.
Just a simple factual question for you, Minister. The herpes zoster, or the shingles vaccine, is there any plans to introduce that? There's been significant research done based on the Welsh study in 2013, where the vaccine was offered free to all people over 79 years of age, and a retrospective study was done. It was seen as a natural experiment, and it showed a considerable reduction in the onset of dementia by up to 25%. So in addition to the rationale to giving someone a zoster or a vaccine for the prevention of pain and the condition itself, which can be truly difficult for older people, especially chronic pain, there's now this additional piece of evidence that would suggest that the cost-benefit sort of analysis has changed.
It's being considered. The cost benefits may have changed. That depends on the price that is being offered. As you're aware, the price is very, very important. There is more evidence emerging in relation to it. This is one, for example, I did hear an ad on RT1 in relation to the shingles vaccine and the benefits of it, which I believe was sponsored by GlaxoSmithKline, much to my amazement and surprise. And I thought that was a new departure in Irish healthcare. We will take all vaccinations with the best information that we can and with the best cost benefit analysis. And we will also, which I think is our responsibility, and I think you should criticise us otherwise, get the best price for the state in every situation, so that we can spend more money on more things. And
I agree with you. No, I have no argument. Look, at the direct patient advertising has come from the United States, from the pharmaceutical industry, and I recognise that fully. But there are jurisdictions that are introducing it, and we should consider it. And
we'll consider it on its merits.
And that's
exactly.
On its merits,
on
absolutely,
its merits and nothing else.
100%. And with the childhood vaccination scheme, vaccinating children for varicella, you would hope that the zoster will be time limited over a period of 50 years, but that's a long time for people to suffer from it. Just a final question, and I'm not criticising it. I understand the cost-benefit issue. In relation to GP training, are we training enough, and have we done any audit on whether the additional numbers in the training schemes are producing GPs on the ground? And is there an audit? Now, if you don't have the numbers for that here now, I'd be quite happy to get it afterwards.
Yeah, GP training places have increased by 80% since 2019, and we've had 348 new entrants since 2025. Training places will increase to 400 this year. I think of also huge significance is the very different approach taken by the Medical Council last summer to improve their registration or their re-registration processes, which resulted in an additional 1,800 doctors being added to the list, to the registration list. And that was very, very important. But again, we've set that against how quickly our population is growing and where we're trying to deliver services. You are aware that we have a specific training course in, I think it's in University College Galway, specifically for rural GP services. And it is one of our biggest challenges right across the Midwest, in particular, access to GP services, particularly out of hours GP services. Of course, we're trying to increase access to healthcare generally, and that is one of the very strong reasons for the Common Condition Service being introduced into pharmacists. So now people can go to a pharmacist and get a diagnosis for a basic issue, and that is also a contribution to accessing more GP appointments for other things.
Thank you.
Thank you. Next, Deputy Colman.
I want to put a few questions to you in relation to your note that you sent in on the new National Children's Hospital. And I know you took questions on this earlier as well. So we know at this stage that we're now at the 18th completion date. It's April of this year. It's a 44-month delay on the original completion date. And we also know that the early access, unfortunately, has not gone as well as we had hoped because, as you say, problems on the contractor side.
Just to be clear, we maximised it and then we went further.
From what you could do, but also from what was promised by the contractor, there are issues.
Yes.
So can I just ask, because this seems to be just a complete mess, time and time again, Groundhog Day with new completion dates, problems with the contractor and so on. The contract that was originally signed surely must have had some legal levers in it to enable you as Minister and for the State to hold the contractor to account, because what's really frustrating is we raise issues, we'll have the board in maybe in the next number of weeks or months as well to talk to them. They'll say it's all BAM's fault, it's all BAM's fault, it's all BAM's fault. And I'm accepting that there is major fault by the contractor here, major fault. It's clear as day that we can see that they're not properly deploying staff, okay? So can you explain to me what legal levers are available to you as Minister for Health, or indeed the State, whichever minister will be responsible for it, to actually properly hold the contractor to account and have those levers being used? Because it seems so far it's not working.
So yes, there are legal levers within the contract where the Hospital Development Board can go to court and essentially withhold funds in the simplest terms, withhold funds, withhold bonds. I'll ask Derek to speak to the more technical side of that, but just for the absolute simplicity, to withhold funds from the contractor, to hold bonds back, to hold payments back, and to pull other levers back. That is essentially what's available within that contractual structure, which was one being used by the government in 2016, 2017. We have, the government learned very significantly from that in relation to contractual design, where there's 2 external design reviews, totally different business case reviews, enabling works being done separately, and very significantly different form of contracts.
But would you accept then, because of that, Minister, would you accept that in the original contract there was failures there in relation to having sufficient levers? Because if there's learnings, and we're not going to do that again, we just need to get to a place where we accept that the original contract has caused us major problems here, because it seems to me you can't hold them properly to account. You can send letters into us, you can write to them, you can raise it in the media, we do, but they're still not doing what they should do, no matter what is being said of them.
And I think this would be the 6th or 7th time I've said publicly that I don't believe that that's the appropriate contractual structure, that we would not do that again. And I can be specific as to the things that we would do differently. But that is the contract that Deeper and the Department of Health negotiated and had to them in 2016, 2017, and it's not satisfactory. There's also, but I may speak to the legal levers that have been used by the board. Okay.
Yeah, again, I mean, look.
Okay.
It's Deputy Burke. Yeah.
Minister, I've raised previously in relation to the essential part of the health services, the dental services, and you referred to new training places for GPs. And in fairness to the whole ICGP, they've done a huge job as regards increasing numbers of training. We haven't done it in relation to dental training places. Okay, I know the RCSI has opened a new college, but we haven't increased the places in Cork, in UCC and Trinity. And the other issue is in relation to where UCC have proposed a dental hub which would provide care for people out in the community. It's a 4.5 million budget, and no progress has been made on that. So, you know, dental services are an essential part of the healthcare sector. And I'm just wondering what is going to be done in 2026 to deal with that issue.
Yes.
And I fully understand it comes across higher education as well, and I fully understand that as well.
It does, and you're right to identify the RCSI additional places and what will further happen in Connolly. We also have to look at the workforce deployment of our dental graduates as well, and the Irish Dental Association have brought a suggestion to me, which is that unlike doctors training in the public system who have a job pathway into the public system, it doesn't really exist in the same way at scale for dentists. Graduates tend to come out and go, what do? Do they go into private practice? And that's often too soon for many of them. The Dental Association have raised a programme with me whereby dental graduates would move automatically into the public system and do a piece of work within that, so that they became familiar, that they were, the only word I can think of is indentured, that they would be put on a programme within the public system for 12 or 18 months on coming out of graduation. I think there's an awful lot of merit to that. That is one of several measures that I will be considering this year to increase dental capacity within the public system.
We have 50 Up until last year, we had 50 Irish people, or Irish stroke European in dental training per annum. That's 50 new people coming in per annum. It's now gone up to 75 per annum. It's still not sufficient. And if you look at the way we've increased the GP training, we've increased it in a very short time period, and we're delivering on it. We need to do this in
I agree, and I will also speak to my colleague James Lawless in relation to that. Dentist numbers have gone up by 27% since 2019, but I also think that we're not using our workforce capacity properly yet. I do believe there's a much stronger role that dental hygienists can play in delivering overall dental services, and I will be changing the law this year to make it clear that they have the opportunity to practice more directly without having to work in the structures that they have been under. Sorry.
Thanks very much on that. Just briefly, and just to note on that, the committee has a draft report in terms of dental, public dental care, and we will be publishing that at some point.
Wonderful. Will it include that piece around the dentists working in the public system?
Certainly consider
that would be great.
Minister, the purpose of today's meeting was around the revised estimates, and I'm particularly concerned around the costings and the big picture reform and Sláintecare and the implementation of Sláintecare. And I've raised this now a number of times around the costings for Sláintecare. At our meeting last June on the revised estimates, I asked if we could get an updated costings for Sláintecare, and Minister said you'd check. Again in September, I raised it with the Secretary General, and he committed to providing the committee with those updated costings. Finally, this week, the committee received a document from the Secretary General. On first glance, it appears to be the costing that I've been seeking, but unfortunately, it's just a breakdown of the 2025 allocation for Sláintecare. I accept this is a complicated and time-consuming exercise, but what we're looking for is the 20 costings based on the 2017 committee report. The previous committee, the Future Healthcare Committee, were able to do a costings to set out how to deliver those key outcomes. That's now outdated. So what I'm looking for is an updated costings on the full implementation of Sláintecare. Has that work started? Has it been done? Can you give us an update on that? The Secretary General committed to doing it when he was here at committee, and I'd be keen to...
I will speak to the Secretary General about that, but I would make the point much more broadly that I am much more interested in simply delivering Sláintecare than at the beginning of the implementation of Sláintecare. There was a dedicated Sláintecare delivery programme which was totally appropriate for and that needed its own funding stream. We are so far into the delivery of Sláintecare that it's going to get to the point where that particular stream of money is no longer relevant, that the funding, we are funding Sláintecare. Nevertheless, I will follow up with the Secretary General in relation to his specific commitment to you.
And if we're going to do it and do it in full, we need to know how much it's going to cost. But and I think that's crucial. Like, we need to know how much the full implementation of Sláintecare is going to cost.
But it costs. It costs what the health. It is the Sláintecare. It is going to be the health budget. Those two things are going to become the same thing.
But the reforms set out in the report, we need to know how much it will cost to implement those. And it has been committed to us that we will be provided with those costings by your department. They haven't been provided. I would like an update on that. Just in the last minute, Minister, I visited Cork Prison last October, and I was really concerned about what I saw in terms of how prisoners are being held and the inhumane and degrading treatment, particularly of people who were on the waiting list for transfer to the Central Mental Hospital. And because of the delays there, and I've asked a series of questions, as you know, in terms of the vacancies, the staff shortages, and quick questions around that. But Minister, what I want to know is, do you accept that the state is violating these people's human rights? So,
Deputy, it's great that you went to Cork Prison. I was one of the chair, along with Ivana Bacik, on the Oireachtas Penal Reform Commission. It's something that I've been engaged in for many years. Very recently, I visited Docus and Mountjoy specifically to put in a programme of health supports specifically for women prisoners. I visited Limerick's women's prison, the old one and the new one, and I was very pleased to see, for example, in the new prison that there is a dental chair there, that there are sexual health violence supports there. I am trying at the moment to move the services of the Mater Hospital into Docus so that women don't need to travel across the road.
And with are we violating people's human rights?
Deputy, I suspect that I know a great deal about this, that I'm very happy to. If you want me to ask me a binary question in relation to that, I could give you the answer that I gave to when I met the Committee on Prevention of Torture. I have been engaged in prisoners' rights for 2 decades, and I can give you a very detailed answer, prison by prison, in relation to it. But what I can speak to is the specific work that I'm trying to do, in particular to advocate for women prisoners, who are by far the most marginalised group of people in Ireland, and in particular traveller women, in particular in Limerick Prison.
And I think more needs to be done.
And I'd like to see that be responded to.
Deputy Sherlock.
The GP strategic review was due to be published last year. I don't see a reference of it today. What's the hold-up? When are we going to see it?
No hold up as such. Working through that, and I've met the IMO on it recently. I think there's a very interesting opportunity to reflect on how we think about the programmes that we've developed and how that intersects with eligibility and how we might think about that. So I do expect that in the coming into the summer is what I have in my mind in relation to it. And I'd like to look at, in particular, a couple of pieces in relation to women's health and in relation to the chronic disease management, which has worked extremely well. And how do we think about that? And one of the pieces that we have to think about in relation to that is when somebody goes into hospital, when they come back to the community, how is that particular piece working? And I don't know the answer to that yet, but you're right to identify it. In particular, we need to look at the out of hours, I think, the out of hours piece as well, which is inconsistent at best.
There's only 3 hospitals that have signed an SLA at the moment, if I understand from your letter of determination, that you've set an end of February deadline.
No, it was the 15th of January.
15th of January is when all the SLAs, so what's the hold up?
I would very much like to know. There was the SLAs were issued to the Section 38 hospitals in December so that we could issue them the year before. They could be signed early. As you know, these SLA signings drifted all through the year and often came with side letters and so on. That's not acceptable. So Bernard Gloucester set a 4-week timeline, which would have been the 15th of January. It's now the 10th of February, and 3 have come back. May I ask Ms. McGurk to speak to that?
So thank you. The update we have is that a lot of them are actually with boards, so it does seem to be reasonably positive. They're waiting for the formal sign-off from their boards. Minister's keeping a really close eye on it, as is the CEO, so we're expecting over the next couple of weeks to have them pretty much finalised.
We won't have a rerun of 2024 when there was a change in funding halfway through the year.
This is the whole point.
I appreciate that. I just want to ask about beds. There's obviously a huge focus in the department now on the quantitative metrics of getting people in, getting people out. I'm much more concerned about the quality of care. The reality is the number of those over the age of 75 are still, there's still just under half of them waiting 9 hours or more in ED departments. That number was the same in 2024 as it was last year, so there's been no change on that, and some of it is because of beds. It's in the service level agreement that there's less than half, just under half waiting 9 hours or more over 75s. So that's back to beds, right? And we just see a commitment of just 134 additional acute beds this year. That is less than half of the commitment under the acute bed expansion plan that was published back in 2024. So, Minister, is this the year where you do very little, and are you expecting to do an awful lot next year, or are you not going to meet that target of 3,000 beds over the next number of years?
I think it's more than that. I mean, there's 428 community beds, which are just as important. If I look at the detox in Letterkenny, for example, which is ranging at about 40, all of whom should be in a community nursing home, which will be available across the road.
There's only 208 now that are new beds. Like there's the majority replacement.
Plus the virtual beds, which we've extended now to another 5. It should be 6 hospitals, but Galway haven't yet, as far as I'm aware, or have only just, and we'll be expanding that to 40 to 50 per hospital as well. That's very, very important as well, and in particularly for older people, where we can keep them away from hospital, where we can keep them home safely, of course. And of course, not all of the, only a quarter. Sorry.
Thanks, Minister. We've 4 speakers remaining, and we'll conclude just after 12 o'clock. I've got Roach, Kyle, O'Hara, and then Quaid. So, Deputy Roach. 3 minutes.
Thank you, Chair. And I have 2 very brief questions, and I want to direct them to the Minister itself. And in terms of, and this is something that I've raised before, in terms of a PET scan machine for the West and Northwest, currently there isn't one except in the Galway Clinic, which is a private hospital. And I know in the past it was suggested that 2030 is the magical year in which we can expect that this machine would be available, and I think in the context of cancer treatment and cancer diagnosis and all the stuff that goes with that, it would be very essential that we would expect that could be delivered earlier, if possible, because the stats tell us that cancer diagnosis isn't getting any less. I think that would play a central part in that. And my second question, Minister, is with regards to, and I've raised this before, in terms, I suppose, of maybe the primary care centres. We have some outstanding facilities right around the country, and I sometimes feel that they're underutilised. And in the context of, Minister Butler mentioned earlier, Mary Butler mentioned that these crisis resolution teams and maybe some of those services could be operated out of some of those primary care centres where you'd have easy access rather than having to go in to in our case it would be UCHG, and if that sort of an arrangement could be considered or put in place.
Deputy, in relation to the outpatient, the primary care centre, for example, Merlin Park, the outpatient clinic there, it's a fantastic facility, and anything we can do to keep people away from acute hospitals where they don't need acute care is important. I think as well what Minister Butler has done in respect of solace cafes, which is a very appropriate, supportive place for people to come and to receive guided signposting and support. There are, of course, mental health staff there. That is an important step forward in the community as well. But you're right to identify that. We will look at it. In relation to the PET scanner, yes, again, you're correct. I would like to see that expedited. You're right. It's only available in the private facility at present. The West does need that, and we're looking at every lever that we can to expedite the delivery of that in Galway.
Good, Margaret. Thanks, Chair.
Deputy Cal.
In regards to the new oncology unit at University Hospital Kerry, can we push on with that? There's an ever-increasing number of patients presenting. There was over 5,000 last year. Kerry patients are travelling to Limerick, Cork, Dublin, etc. There's a great need, and I suppose when you look at RIPs in Kerry, and I'm sure every other county is the same, there's an increasing reference to palliative care. So just ask the Minister to push on with the delivery of the new oncology unit, please. In regards to the A&E department and the trolley crisis in Kerry, and I know it varies from time to time of the year and month to month, etc. The obvious solution, and I'm told this by management in Kerry, in addition to the existing beds that are under construction, there's a need for a new 96-bed block. Again, I'd ask that, Minister, if you could kindly move that forward as well and deliver it. Can I ask the question in regards to the new Killarney Community Hospital, when will it open? That's a huge question that's been asked very often in Kerry. In regards to the minor injury unit for Killarney, this is hugely important because it will take massive pressure off the A&E unit in University Hospital Kerry. Can I get an update on that? Beds in our community hospitals, there's a number of them in Dingle and in Carsaveen and Kenmare that remain unopened for prolonged periods of time. Can we see any light at the end of the tunnel there?
There's just 1 minute left now if you want an answer to those questions, Deputy.
Okay.
Okay, sorry, do you want to put the community nursing unit?
Yeah, just to very quickly, thanks, Deputy. The new CNU in Killarney has been handed over to the HSE at the end of in December. The HICWA application will be going in very shortly, and it's intended to have it operational by the end of March.
End of March, thank you.
And then the other nursing homes, the other areas you speak about, as you know, the West Kerry Community Hospital, that's fully operational, and the other ones maybe you might come back to with specifics on those. Do you want to give those, Derek? If you just give us, there are three particular ones, Carsaveen.
Yeah, Kenmare, Carsaveen.
If you have details on it, there, but if not, we'll come back to it, maybe more details on it.
A note back.
We'll give you a note on it.
Thanks for facilitating me. So I noticed in the estimates the indicative funding for the National Ambulance Service has increased by 12.5 million for 2026. And just in relation to that increase, something I've raised before is the need for provision of a rapid response vehicle at the Tuam ambulance base in County Galway. Something I raised with Minister Murnan O'Connor in the Dáil back in December. And just to give a bit of context, I suppose the crews in Tuam cover a really vast area, kind of across North and East Galway and South Mayo as well, and they are dealing with a very high volume of calls, and they need more cover. We had the introduction of a second ambulance there on a 24/7 basis last year. That kind of shows the high level of calls in the area and the need for this vehicle. The local staff there are telling me that they're never at the ambulance base. They're constantly out on calls, and if this vehicle was available 24/7, staffed by an advanced paramedic, that it would make a huge difference in the local area in terms of achieving better outcomes for patients. So I want to ask if the Minister could provide detail just on the additional 12.5 million in funding, and if there's any further update that you can give regarding the provision of this vehicle at Tuam, and if it's something that maybe you could engage with the National Ambulance Service on.
Yes, I will speak with the National Ambulance Service, but I will also speak with the REO of the region, and I hope, Deputy, that you will also raise it with the Regional Executive Officer and that we will begin those channels as well, because I think it's very, very important for deputies that we do that now that we have a devolved regional model as well. I will be meeting that team tomorrow and I will specifically raise that with them. But yes, we are, that is what we're trying to do.
Yeah, that would be appreciated. Minister, like the base there is equipped to cater for this, and there are advanced paramedics in the area who could operate it, so it would make a huge difference. And just briefly then, to follow on from an earlier question, just around the PET scanner, obviously we don't have any in the west and northwest. The timeline is 2033, as I understand it, for UHG. What specifically is causing that delay? And I welcome your comments that you're going to try to expedite that, and I suppose what specific actions are you looking at there?
Well, I might speak more broadly in relation to the UHG master plan. Like, there has been a delay in putting that together, frankly. There now is a master plan, and now we can move ahead with a sequenced body of work for development of that campus more broadly. May I ask Mr. Tierney to comment on it?
And that's fair. I mean, the DCP actually prioritised bed capacity in the first instance. So the region has said beds are our priority, so we can't deliver everything at the same time. So this has to be prioritised in terms of successive delivery of infrastructure. So we start with beds.
Yeah, so what that is a development control plan that's been developed by the hospital, because the hospital, it starts out looking for all sorts of different things, and eventually then it comes together as a single unit and saying this is what we need. They have said beds are the priority, so let's deliver beds first, and then there's a sequence about how everything is delivered. That has been going on for, I'd say, 10 to 12 years at this point. It's not okay, but there is a plan now, and there will be sequential development of the site to meet the needs as identified by the hospital.
Thanks, Minister. Our last speaker is Deputy Quaid.
Thanks very much, Chair. Minister, we had a joint meeting of the Health and Disability Matters Committees in late January on the crisis in primary care services for young people, and the backdrop to that was the reality that across health regions and across disciplines, young people are in late January on the crisis in primary care services for young people, and the backdrop to that was the reality that across health regions and across disciplines, young people are routinely waiting 2, 3, 4, 5 years for appointments, in some cases far longer. Waiting for support, I think it's important to say that is generally short term. It's not wraparound, multidisciplinary, sustained input. So across disciplines such as OT, psychology, physiotherapy, speech and language, and the context for that has been years of under-resourcing, chronic neglect by successive governments, followed by the more brutal impact of the recruitment embargo in 2023-2024, which was then followed by the restrictions posed by the pay number strategy. And regardless of government narratives, I know that these services have been left with threadbare staffing over many years, and there have not been efforts to recruit in these services to anywhere near the level of need that exists, and that continues, and that's a fact. Outside of the single point of access initiative, which I agree with, by the way, what commitment are you making, Minister, to recruitment of permanent staff to these services? What kind of staffing benchmarks per population can we expect?
Deputy, sorry, I'm just looking for something in my... so in relation to that's not it, sorry. Excuse me, sorry, I was looking for something specific to try to give you an answer to that. That's not it. This is part of our overall headcount increase that we have, and it's for the regions to allocate that based on their different needs. Some regions performing better than others, some having more vacancies than others, some having more need than others. So they're going to have to bring that together in alignment. We do have a focus on primary care and in particular in relation to the very, very long waiting lists that have been there, particularly in relation to the psychology, which I know is something that you raise, in particular in relation to occupational therapy, speech and language therapy. And as you know, there was a particular primary care long waiters initiative begun by the HSE in the last quarter of last year, which has taken thousands of people off that wait list. I have to say, many cases through validation, but that in itself is an important clarification.
What about staffing benchmarks going forward? How many OTs per population, like as we had in a Vision for Change across services? Can you make any commitment in that regard?
No, I can't make any commitment in that regard at the moment. We have another 461 places across the 9 priority disciplines, but I can't, and an additional 310 student places, but which will include 20 occupational therapy, 10 in speech and language, and 142 in physiotherapy. Our bigger difficulty at the moment is recruiting those teams and making sure that they're there.
I think there's been this narrative.
I don't agree with you that there haven't been efforts to recruit.
Not anywhere near the level of need.
That's different. That's different. We are trying to recruit every person that we can. We are trying to change the agency conversion into permanent staff and to try to make that happen.
There are services I know where recruitment is basically stalled.
Well,
for
if
years.
you would like to bring those instances to me in great detail, I will follow them up in great detail. But I can't speak in generalities as to the recruitment of every person in every part of the health system.
That's the general
What we are
picture.
trying to do, though, for example, in Limerick, they converted 62 agency staff into permanent staff in the last quarter of last year, with the target of 100 this year, in the first quarter of this year. So that speaks to the effort that is going into trying to recruit permanent staff. If there's a specific issue that you want to bring with me,
it's a general picture.
Then I can't answer in generalities. If you bring me a specific problem, I'll solve your specific problem.
Thanks, Minister. That is the end of our speakers list. That will conclude our consideration of the 2026 revised estimates for vote 38 in Department of Health, unless there's any objections to that, which I don't think there are, so it concludes that. In accordance with Standing Order 101, a message to that effect will be sent to the Clerk of the Dáil. Again, I'd like to thank Ministers Cara McNeill, Butler, Muireann O'Connor and O'Donnell for joining us and for taking all the questions. And then a lot of issues raised this morning. No doubt we'll be back to some of them again in more detail at a future date. And thanks to the officials as well for joining this morning. Members of any other business? No. So the meeting is now adjourned. Gurmagat.